Good evening and a warm welcome to everyone. Ayurveda presents Chatushtaya 2023 National Seminar with paper and poster presentation. And I welcome each and everyone to this 3-day paper and poster presentation. So on the second day, first of all, let me invite our respectful panel members. We welcome you all. And without taking any more time, I would now like to request all the participants to be present on the time. And the presentation will be live on YouTube channel and copy will be saved. So please don't unmute yourself unnecessarily. So first we can start with our paper presentation. And I invite Dr. Jairam KV for the presentation.
Is it audible?
Yes, doctor, it's audible.
Presentation is visible, no?
Yes, doctor.
Yeah. A warm welcome to one and all of you. My topic of presentation is Network Pharmacology of Ayurvedic Formulation, a transdisciplinary approach. Coming to the introduction, network pharmacology is a system biology as well as network physiological unit in which where the Ayurvedic pharmacodynamics should be studied. Here, in Chinese traditional medicine, namely Guisi Shayayo Singhu, was studied the importance of its pharmacology was studied using this network pharmacological method in diabetic peripheral neuropathy. The pharmacological networks in the Ayurvedic formulations can be introduced through this. Here, I construct with an example of Tripala. The domains under this network pharmacological units are bioactives, targeted, and disease as well as its indications. To integrate system biology and computational biology in multi-targeted, multi-component formulations in Ayurveda is the aim, and the objectives are the Ayurvedic pharmacodynamics through systemic data mining, investigate unexplored molecular targets. The methodology for this network pharmacological unit construction for Ayurvedic formulation, here I use an example with Tribala bioactive network. First, I construct a pharmacological network using the software Cytoscape 3.2.1. In Ayurveda, the whole bioactives involved in a Tribala network can be retrieved through the web data Universal Natural Product Database. After that, construction of the binding database with bioactive target interaction were constructed. The target of bioactive searched in therapeutic target database where the whole bioactives as well as in indications are available there. After that, target having the score 1 were selected. That's why here we constructed the bioactive network. After, in the same manner, relevant disease as well as its underlying pathways are also constructed by disease network construction. This is the manner by development of network pharmacology in Ayurveda with an example of Tribala. Let me example the major bioactives in Tribala are Umbilica officinalis, Umbilica terminalia delirica, and Terminalia cebula are the three bioactives. These lines represents the edges, and this circular one represented the nodules, and this dark color or the black color circles represents the having the target, having the score 1, maximum number of indicated products. This, the triangular one, represent the bioactive principles as well as the molecular target. The I represent the inhibited target, U represent unknown target, A represent the activated target. Here the Tribala bioactive network, the inhibited targets are more. In the same manner, Tripala disease network are constructed where the cancer found the utmost position. The triangular represents the most number of indicated target. Okay, like that, the triangular one represent the indications. Among that, cancer, cardiovascular disease, nervous disorders, and metabolic syndrome occupies the most position. Among them, cancer occupies the most. So, among the cancer itself, again a AAA cancer network are created, and we find out that AAA pancreatic cancer occupies the most position. The octagonal represents the further levels of the cancer where it indicated. Like that, network are being constructed step by step. So, among 25 bioactives, 45 protein targeted principles are noted with a 74 possible combination. Target inhibited were insulin receptors, beta secretase, CP and 450 serine, target activators, glutathione. And the disease network, cancer occupies the most position. Among them, pancreatic cancer occupies the most. So here I conclude that Ayurveda have multi-targeted formulations explained in various Chikitsa Manjari, Yoga Ratnagaram, Yoga Manjari, etc., and Brihatrayi is also where the loads of indications are being explored. So where it is the particularly indicated, where the most important should be studied, so that this network of pharmacology occupies the most position. To design the experimental as well as the clinical studies, this becomes a utmost position. So this network pharmacology of Ayurvedic formulation can be used as a prototype for startup, business, and marketing possibilities in Ayurveda for global scenario. So these are my references. Thank you.
Thank you, Dr. Jairam.
So next I invite Dr. Suraj Bane.
Dr. Suraj, are you there? Next, I invite Dr. Bhushan Patil for the paper presentation. Dr. Bhushan Patil, are you there?
हाँ sir, I am audible.
Yes, doctor. Please share the screen, doctor.
हाँ sir. 1 minute sir only. Sir, is my screen
Visible, doctor. Your screen is visible. Please start the session, doctor.
yes sir. My topic is observational study of Rasavaha Strotas Dushti in Amavata by evaluating the Rasavaha Srotas Samanya Chikitsa. Introduction. Amavata is a disease in which vitation of Vata dosha and accumulation of Am take place in the body and predominantly in joint. Vitated Vata accumulate Am over the body through the dhamni, which take the shelter in the Slesmasthana. Symptoms of Amavata resembles rheumatoid arthritis very much. Based on the clinical presentation, treating rheumatoid arthritis is a main challenging problem to the medical field and it does not completely cures the disease. In Ayurveda, detailed description of management of Amavata is mentioned. Rasa Dhatu in Ayurveda, the food substance is composed of 5 predominant substances, is of 4 types: masticable, potable, illicit, and eatable. Contain 6 rasa and possess their 2 or 8 type of potency and has many property when eaten, digested and metabolized properly. Return nutrients essence of food which is absorbed from intestine after the digestion is extremely fine, and this is called rasa. Rasagni is a concept of Agni described in brief. There are 3 types of Agni, namely Jataragni, Bhutagni, and Dhatvagni. Aggravation of Jataragni result in the aggravation of diminution of Bhutagni and Dhatvagni. Therefore, all means one has to protect Jataragni, consume suitable diet. and behavior, because power of Agni or normal condition of Agni is responsible for strength, health, and vitals. Breathe. रस व स्रोत दृष्टि हेतु. There is श्लोक गुरु शीत अति स्निग्धम अति मात्र समस्तताम रसवाहिनी दुष्यंती चिंतना अति चिंतना. Guru Ahar, excess intake of heavy diet like Chinese fast food, cheese, bakery product. Shita Ahar, excess intake of cold food and product. Ati Snigdha Ahar, eating of too oily food. Samasan, taking wholesome and unwholesome food together. Mansik Hetu, like Chinta, Rasavaha Skrutu, Dushti, causing cardiac diseases, hypertension, and ultimately mental hampered mental and physical nature. Amvat Vyadhi Hetu, Viruddha Ahara Chestasya Bandhu Agnil Arsyasa Snigdam Bhuto Annam Vyayama Kurtvanta Sada. Nidan is defined as the factor which disturb the active state of dosic equilibrium, aggravate the disease, is known as Nidana. What Nidani is of many side, various Acharya mention their different view for the production of Ama in Amvata. Amvat Samprapti. Viruddha Ahara Chestasya Mandur Agnil Nichara Snigdha Bhutvanno Vyayama Kurvanta Sada. The impairment of Agni produce the condition of Ama, mainly Agni Mandya, initially affect the digestion of metabolism. Hence, in this state of Agni, the Rasa Dhatu is not formed up to the standard level and is considered as a Ama. If Ama gets obstructed in China and promote the further vitation of Vata dosha, this morbid arm circulate universally in the body and with predominantly for accumulate as Shleshmastana. If facilitate the Stroto Abhisandan, Stroto Dushti can happen. And this Ama is present with Sandhisod, Agnimandya, Zwara, Angagauro, and Arasya. Amva Samanya Lakshan. Angamurdu Aruti Krusna, Arasya Gauram Zwara, Supaka Sunnata Anganam, Amavatasya Lakshanam. Amavata is a condition which present with the symptoms like pain, swelling, stiffness, and loss of function of affected joint. It is due to the formation of arm which get associated with Shleshmastana and produce symptoms as discussed above in the Samprapti. Rasavaha Srotas Samanya Chikitsa Susta. Rasajannam Vikaranam Sarvalanganam Aushadam. One should take the recourse to fasting of all type or all cure of disease caused by the vitation of Rasadhatu. Rasavaha Srotas are channel for the carrying Rasadhatu. Hence, Dushti of Rasadhatu is a first dhatu. Its Dushti lead to the vitation of 6 other dhatus. Rasavaha Srotodushti is a mostly caused by the Agnimandya and Ama. Hence, Langan is the best therapy among the Upakrama. The purpose is to make the body light by relieving heaviness. Discussion. What occurs in all over the world, in all races, gender, and climate. It is always correlated with the RA, means rheumatoid arthritis of the modern medical science. Amvata is a disease of Rasavaha Srotas. Am is produced as a result of incomplete digestion of undigested food, which ultimately violates the Rasavaha Srotas. Hence, treating Dushta Rasavaha Srotas is like the treating of Amvata. Conclusion. Amvat, rheumatoid arthritis in a modern medicine, is a disease of Rasavaha Srotas caused due to the Dushti of Ama and Vata. Amvat being the disease of Rasavaha Srotas. Understanding the Samanya Sutra of Rasavaha Srotas can be applied to the treatment of Amvat disease. Thank you. Thank you, sir.
Thank you, Dr. Bhushan.
Yes, ma'am.
So next I invite Dr. Bindusree. I invite Dr. Bindusree.
Yes, ma'am. May I audible?
Yes, doctor.
Yes, Doctor Audible.
Screen is present, no? You can see.
Doctor, screen is not visible, Doctor. Can you
Whether
please
it's
share?
visible now?
Now visible, Doctor. Your screen is visible. Please start the session, Doctor.
Okay. My topic of presentation is Nidra, and I am Bindusree from the college, Government Ayurveda College, Kannur. I am moving to my topic. Introduction. Nidra is an important for maintenance of our health, and there are different interpretation about the phenomena of Nidra, and it can be classified as yogic concept, Upanishad concept, and Ayurvedic concept. While moving to the yogic concept, there are, according to yogic philosophers, Yoga Nidra is a phenomena pertaining to various states associated with Atma, and it is termed into 4 stages, that is Jagrada Avastha, Swapna Avastha, Sushupta Avastha, and Turiya Avastha. And similarly to Upanishad concept, it is of 4 types. That is, last one is changed to Samadhi Avastha. And while moving to the Ayurvedic concept, Ahara Shayana Brahmacharyam Yukte Prayojidaihi Shariram Dhare Nityam Agaramiva Dhare. So Nidra is included in the one among the Trayobastamba. Others are the Ahara and Brahmacharya or Brahmacharya. And the Nirukti is Nindyate iti Nidra according to Shabda Kalpadruma. And synonyms, Charaga, it's mentioned as Buddha Datri, Susruta, Vaishnavi, Maya, and Ambara Kosha, it is mentioned as Shayanam, Swapnam, Swabam, Samvesham, and Manduka Upanishad, it is mentioned as Susupti. So the mechanism of Nidra is Yadatu Manasiklande Karma Atmana Klamanudam Vishevya Nivartane Tada Subhidi Manava. That is, the mind, including the sensory and motor organs, is exhausted and they dissociate themselves from the object and in the individual sleep. So according to Chakrabani, Karma Atmana means it is the Indriyas. And according to Ashtanga Sangraha, Shleshno Vriteshu Srodasu, Srama Tupardeshu Cha, Indriyeshu Swakarmebhyam, Nidra Vishadi Dehina. That is, the Srotas become covered by kapha and body become fatigued by exertion, and the sense organ quitting from the functioning and the individual goes to sleep. And according to Sushruta, Nidra, the Hridaya is considered a source of Chedana and Tamas is prevalent there. And when Sattva is predominant, one will be aware of the external environment. And effects on heart, if the heart will be Hridaya similar to the Pundariga, that is the lotus facing downward, and while it will be blooming in wakeful state and it closes while one is asleep. And sleep is defined as a temporary state of unconsciousness from which the subject can be aroused by appropriate sensory stimuli, and it is different. There are different stages, that is NREM stage 1, 2, 3, and 4, and REM sleep stage. And eyeball movements are tuned with the activities of the brain, and they are recorded by EEG. And the physiological changes during sleep is Vishayobha Nivartana can be correlated to the systemic changes happening in our body, that is CVS, heart rate, cardiac output, vasomotor tone, and BP decreases, and in respiratory, tidal volume, respiratory rate, pulmonary ventilation decreases, and BMR decreases by 10%, whereas the urine volume decreases with specific gravity and increases. And secretions, lacrimal decreases, and sweat secretion increases, and muscle completely relaxed with the minimum tone, and reflexes, deep reflexes are decreases, and superficial reflexes are unchanged, and GIT, saliva decreases, gastric secretion is not altered. And next, moving to the types of Nidra, there according to Sushruta, there are 3 types: Tamasi, Swabhaviki, Vaigariki, and Tamasi is known as the Nama Nidra, Sambhava Tanava Bodhini, Sapralaya Kala Hedu. That it can be correlated to coma state. And Swabhaviki to Trividam, they are of 3 types: Tamo Bhuishtam, Rajo Bhuishtam, Sattva Bhuishtam. And Tamo Bhuishtam, the person will be sleeping in both day and night, and Rajo Bhuishtam, anytime they will be sleeping, and Sattva Bhuishtam, they will be sleeping at the midnight. And the next classification is Vaigariki, that the person fighting with the disease will be having this Vaigari type of Nidra. And next is the 4 types according to Ashtanga Hridaya. They are Mithya Yogam, Adi Yoga, Hina Yogam, and timely sleep. So the first 3 is considered as unhealthy, and last one is considered as healthy. And according to Ashtanga Sangraha, there are 7 types. They are Kala Sovavam, Amajam, Chitta Kedodbhavam, Deha Kedodbhavam, Krododbhavam, Aganduvam, and Tamobavam. Sambhava. And according to Charaka, Tamobhava, Sleshma Samudbhava, Cha, Mana Sharira Srama Sambhava, Aganduki, Vyadya Nivartni, Cha, Ratri Swabhava Prabhava, Cha, Nidra. And according to Sharya Swabhava Sambhava, we can correlate that due to the breakage of the ATP, the excess amount of the adenosine is accumulated, which induces the sleep, and the excess activity during the daytime helps to produce the sleep at night. And Vyadhi Anuvartini, the cytokines that are formed by the immune cells during infection induces sleep, and sleep even occur in the fever. And the Ratri Swabhava Prabhava, the day-night cycle is the signal generated by the reception of light, and which reaches the brain and controls the secretion of the hormone called melatonin, when which induces the sleep. So the next is the time of the Nidra. Here it is explained that Eda Kala Madho Nidram Ratro Seveda Satmena Satmena Jagad Ardo Prada Swad Bhuktam. So the one has to sleep at the right time, and if it is not remaining awake at night, compensated by the sleeping for half the time that without taking the food. And next is the proper way to sleep. Swastirnam Shayanam Vesham Sugam Kalasthilojidam Anethachidam Nidram Pranishtam Sa Nimittadaha. So one should be sleeping in the comfortable bed, and after sleeping after meals, Bojana Anandaram Nityam Vada Haradi Pittarat Kafam Karodi Vapusam Pushtim Saukim Tanedicha. That means it is specified the Vada and Pitta and increases the kapha and promotes nourishment. And sleeping method, Vamadi Shayanam Manalam Nabe Urdam Asti Jandunam Tasmastu Vama Parsham Shaidam Bhukta Prabhagaram. That is, one should always sleep in the left position for easy digestion of the food. That is the Jadarak, as the Jadarakni is located in the Nabi region. And suitable place for sleep, Tridosh Shamanim Katvam and Tuni Vada Kafabaham, Bhushaya Brahmanam Vrishyam Kashtapattim to Vadala. And benefits of Nidra include Nidra Ektam Sugandukta Dukkam Prishtim Kasha Balabalam, Drishadam Klivadam Jnana Vatnanam, Jivadanacha, Sugayushim Param Kuryat Kalanatrim Vivaparam, Savektam Punaktam Cha, Nidra Deha Sugayusham. The next is the method to induce sleep. There are Ahara and Vihara, Ahara, Gramerasa, Anubarasa, Shalianna, curd, etc. And the Vihara include Abhyanga, Utsadana, Snana, eye massage, etc. And the Ratri Jagana and Diva Sopnam, Ratri Jaganam, Ruksham, Snigdam, Prasonam, Diva, Aruksham, Anabhishandin, Twasinam, Prajalidam. So indication of the Ratri Jagarna include Kafa Meda Vishartanam, Ratri Jagarnam, Hidam. And next is the Diva Sopna. The nature of the Diva Sopna is Snigda, and effect of the dosha is Kafa Pittakara, according to Charagan. Sarva dosha pragobagam according to Susrudam. Indication Diva Sopnam, Trishula, Hikka, Ajirna, Adisaranam. Contraindication Medasvinam, Sneha Nityam, Sleshmanam, Sleshmaroginam, Dushi Vishartam, Divana, Shariran Kadajan, Sharians Kadajan. According to Ashtanga Hridaya, Akala Nidra is there. Akala Shayanam, Moham, Jwaram, Staimitya Penasam, Shirorup, Shofa, Rilasa, Rodo, Akni Mandada. So the treatment includes Tatra Upavasa, Vamana, Sveda, Navana, Aushadam. And according to Ashtanga Sangraha, Adinidra, Apachyamanam Bahulya, Srodasa Vrunur Kafam, Tadaha Srodasa Ruddeshu Jainde Gatra Gauravam, Guru Gatra Sachaga Alasyam Adinitrada. So the treatment include Adinidra and Tishna Prachandana Anjanam, Navanam, Langanam, Chindim, Vyavam, Shobha Bikrutam, Evirevam, Chanidram, Nasha, Sleshma, the Samraksha. So Sleshma is always protected, and Nidra Nasha include, according to Ashtanga Hridaya, Nidra Nasha Angamarda Angamarda Gaurava Alasya Jrambiga, Jade Glani Brahma Paktim, Tandra Rogascha Vadaje, and treatment includes Shilayan, Manda Nidrasu, Shira, Madhya Rasan Dadi, Abhenga Udvartana Snana, Murda Karnakshi Tarpanam. Next is the Nidra Vegadarnam, Nidraya Moha Murdam, Akshi Gaurava Alasya Jrambiga, Anga Madam Tatrishtam, Sopna Sambhana. So Sopna and Sambhana is told as a treatment for Nidra Vegadarna. Then moving into the conclusion, Nidra is one among the Trayobustamba. There are different types of Nidra mentioned by different Acharyas, and abnormalities of the Nidra include the Ratri Jagara, Diva Sopna, Adinidra, and the Nidra Nasha. Then these are my references. Thank you.
Thank you, Dr. Bindusree. Now I invite Dr. Nija Chacko. I invite Dr. Nija.
Hello, ma'am.
Good evening, doctor. You're audible. Please share the screen.
Ma'am, is it visible?
Yes, doctor.
May I start?
Yes, please, doctor.
Good evening, all. Myself, Dr. Vijay Chacko. My topic presentation is Pranavaha. Introduction. The word Srotas is used as a generic term indicating all the micro and macro channel and pathways operating in the living organism. It is the Srotas given by Acharya Charaka and Sruta. It is a choice and conveying Pranavayu
Hello,
to the
doctor.
body.
Hello, doctor. Your voice is not clear, doctor.
Sir, now it's clear?
Now clear, doctor. Now it's clear. Please continue, doctor.
Okay. Pranavaha Srotas is a channel containing Pranavayu within the body. The respiratory system with both of its conducting and respiratory passages. There is the clinical condition associated with the organs of respiratory system can be considered as the clinical condition affecting the Pranavaha Srotas. Agni Soma Vayu Sattva Rajas Tama Panchendriya Bodhatma iti Prana. Prana Vahanti iti Prana. That is the transfer or conduction of this prana through all structures of the body is Pranavaha Srotas. Moving on to the Mulasthana, that is according to Charaka, Hridayam and Mahasrotas. According to Susruta, it is Hridayam and Rasavaha. First, Mulasthana Hridaya. It is responsible for taking the impure blood and propel it to the lungs for purification. In many of the cardiac diseases, Shwasa and Kasa can be seen as a symptom. That is particularly the Shwasa like Maha, Urdhva and Chitta Shwasa. In Vegadharana by Acharya Charaka, Hridyoga in Srama Shwasadharana and Kasadharana. And from this also, heart rate and respiratory rate are in the ratio 4:1. In second Mulasthana, that is Mahasrotas, the Puppusa, Trachea, and its branches, bronchi, all these structures can be included under Mahasrotas. Mahasrotas is one of them, is synonym to Koshta, and the Puppusa can be considered as one among the Koshta. Puppusa is shown in the Pena Prabhava, the lightest part of the blood which is rich in Vayu and Akashamudha. The lungs resemble a cluster of bubbles or multiple airfields. So shown in the Pena Prabhava indicate the functional anatomy of the lungs. Puppusa is the moola of Udagamaha Srotas. That is, we know that the lungs play an important role in water and electrolyte balance. Third Mulasthana, Rasavaha Dhamani, that is the artery carrying oxygenated blood from Puppusa to Hridaya and then to all body tissue. Hridaya is the seat of Ojas, Prana and root of Rasavaha Srotas. Then Murda, which is the seat of all Indriya. Here we can consider it as the respiratory center. This is the layout of the tracheobronchial tree, trachea, bronchus, and up to the terminal bronchus. Then moving on to the Nidana of Pranavaha Srota Dushti, Shaya, Sandarana, Aushadh, Vyayama, Shuddhidasya, Pranavahini, Dushyanti, Srodamsi, Anyashadharani. That is wasting, suppression of urges, roughness, physical exercise during hunger, and affection of other Srotas all contribute to the Nidana of Pranavaha Srota Dushti. Then Srodamsi Anyashadharani means other Srota Dushti affect the Pranavaha Srotas. That is by considering the Udagavaha Srotas. In Vadajadasara, Shwasa can be seen as a Lakshana. In Krishna, Shwasa as Subhadrava. In Adisara, Shwasa as Asasa Lakshana, etc. And the same effect can be seen up to Shukravaha Srotas. Then moving on to Srota Dushti Lakshana, according to Acharya Charaka, Adisrishta, Adibetta, Kumida, Alpalpa, Vikshanam, Sashabdam, Sashulam. And so, with the Lakshana explained by Acharya Sruta, Akroshana, Vidamana, Mohana, Brahmana, Vevana, and Marana. Moving on to one by one, that is Adisrishta, increased rate and force can be seen in tachypnea, deep sighing, respiration, etc. Abhishnam, continuous breathing in chain stroke, respiration, hyperpnea condition. Adivetta Ujjvasam, restricted respiration in deglutition apnea, obstructive apnea, etc. Alpalpam with the interruption in shallow respiration. And Sashulam with the pain, that is costochondritis, etc. Sashabdam with the that is cough with sound. Kubidam, that is dyspnea. That is mechanics of respiration include respiratory muscle, movement of thoracic cage, movement of lungs, etc. That is, the exchange of respiratory gases take place with the help of the partial pressure of oxygen and carbon dioxide at the arterial venal end. This change helps in the exchange of respiratory gases and the transport of respiratory gas, that is oxygen as simple physical solution and in combination with the hemoglobin, carbon dioxide as dissolved form, carbonic acid, bicarbonate, and carbaminocompone. The regulation of respiration include neural control mechanism, respiratory reflexes, and chemical control mechanism. That is, Gulma, Hridroga, Sammoha are the symptoms explained in the Srama Shasadharana. Some of the diseases of Pranavaha Srotas are Kasa, Shwasa, Hika, Urakshada, Rajeshma, Shosha. In Kasa and Shwasa, Vada Pradhana Dosha affected. Srotas is Pranavaha Srotas involved. Vimargamana and Sangha are the Srota Dushti engine. The disease affecting Pranavaha Srotas are tuberculosis caused by Mycobacterium tuberculosis, pneumonia with the acute inflammation of lung parenchyma, pleural effusion with the excess fluid accumulation in the pleural cavity, bronchitis, inflammation of the bronchial tube, cough and bronchiectasis, that is permanent irreversible dilation, enlargement of the part of airways, and bronchial asthma, inflammation of lung characterized by reversible airway obstruction, and the COVID-19, which is caused by SARS-CoV-2 symptoms like cough, fever, muscle pain, headache, etc. The respiratory process, Nakhista Prana Pavana, Srishtva Kamalandaram, Kandad Bikir Vinariyadi, Padam Vishnu Padamridam, Pitwa Chambara Piyusham, Punirayadi Vegadaha, Prinayan Dehamagilam, Jivain Jadadanana. This is the respiratory process explained by Acharya Sushruta. That is the respiration helping maintain all the homeostasis of the human body. Then treatment, Shwasiki treatment, Snigdha Sweda, Snigdhodana, Vamana, and Liyadosha Dhuma. Moving on to conclusion, it is of Pranavaha Srotas is of very vital importance in maintaining normal functioning of the human body. Hridaya and Mahasrotas are the moola of the Pranavaha Srotas, mainly vitiated the disease of Pranavaha Srotas and Rasavaha Devika transportation of Pranavayu. Pranavaha Srotas plays multi-dimensional role as it carries most of the vital element, that is Pranavayu. These are the references. Thank you.
Thank you, Dr.
Thank you,
Nija.
Dr. Nija. So next I invite Dr. Devika. I invite Dr. Devika.
Am I audible now?
Yes, doctor.
Your screen is visible, doctor. Please start the session.
Good evening all. Welcome to my presentation. Myself, Dr. Devika. My presentation topic is concept of Triguna. Concept of Triguna dates back to Atharva Veda. It is mentioned in Atharva Veda. It is also mentioned in Bhagavad Gita, Science, Sankhya also. As like other Veda forms the basic humors of the body, Triguna considered to be the mental humors. It is utilized to explain the concept of personality in modern era as well. Trigunas are Sattva, Raja, and Tamas. Personality is understood by three major domains in Indian philosophy, from which Indian psychology has evolved. They are Panchakosha, Pradosha, and Triguna. Panchakoshas are Annamaya, Pranamaya, and Manomaya, Vijnanamaya, and Anandamaya Kosha. Manomaya have relation with the Triguna. Guna refers to the inherent energy or tendency with which Prakriti is created and with which human mind functions. Trigunas in different proportion influence the mental and intellectual caliber of every individual. Dominance of Guna determines the individual's personality. It will have a role in evolution also. By the Sarvabhudana, Karanamagarana, Sattva-Rajas-Tamo Lakshanam. By the combination of Sattviga Ahangara and Rajasa Ahangara, Ekadasha Indriya originates. By combination of Rajasa Ahangara and Tamasa Ahangara, Panchabuddha is evolved. According to Sankhya view, Priti, Apriti, Vishadharmaka, Prakasha Pravati, Niyamalmika is Guna. Sattva Guna having Lagu Prakashaka, that is Lagu and illuminating, Rajas Chalamcha Ubashtambakam, are the principle of activity in things. It always moves and makes other things to move. Tama is Guru Varanamega, Guru and obstructing the manifestation of objects. How they exist each other? They exist by Anyonya Abhivava, Ashraya, Janana, Mithna, Nitayasha. The gunas are in a state of both conflict and cooperation with one another. They always go together and can never be separated from one another. According to Charaga, Sattva is Adoshala, Rajasam Doshalam, and Tamasam is Doshalam. Sattva is Adoshala due to Kalyanam Shatva. And the Rajasa, the Dosham Shatva, then Tamasam Okam Shatva. According to Ashtanga Hridaya, Sattviga Prakriti is mentioned like cleanliness, have faith in God, right? Yes, the Shukla Dharma, Dharma Rujirmadi. Rajasam have talkative in nature. Mana, Krun, Damba, Abhyasam, Alsaram, Damba Malsaram also is there. Tamasam, Hayam persons are covered, illiterate, and sleepy, lazy, and non-enthusiastic nature. According to Sushruta, some Sattviga people have non-violence, Anasamsham, Samvibhagan, Dati Diksha, Satya Dharma Madhuruji, that is desire of sharing food and all. And Anabhishanga nature, tendency of doing good actions without expectation in return. Rajasa pupils have wandering nature, Dukha Bakulada, Adanashilada, Abhrudi Ahangara, Digatvam, and all, wandering untruthfulness and overweening confidence on one's own excellence. Tamasa have Vishaditum, Nastikyam, Atharmashilada. And Tamasa peoples are always in a sleepy mode. In general, we can consider this as Sattva Guna have balance, harmony, positive peace and clarity. Rajasa have movement, activity, energy, excitement and passion. Tamasa have energy, inertia, inactivity, negativity, apathy and dullness. In animals also we can notice this because Charagacharya have mentioned that this Triguna is always in every individuals. So in animals also we can see this type of natures. Individual psychology. Shariramadi Sattvam Anubhivade, Sattvam to Shariram. Sattva Tara Lakshanas are mentioned in class 16 types of personalities based on the classical Guna therapy. Sattviga Sattva Brahma is 7, Rajasa Sattva 6, Tamasa Sattva 3, Pashava, Mansya and Vanaspatya. Sharira and Manasa Dosha relations are Sharira Dosha, Vatra Dosha, Manasa Dosha, Rajastama. Mutual relation between Pradosha and Triguna are Vayu, predominantly Rajas in nature, Pitta, Sattva, Gunotara, Kava, Tamo Bakula. And there are also relation between Panchamahabhuta and Triguna. Tatra Sattva Bakula Magasham, Rajo Bakulo Vayu, Sattva Rajo Bakulo Agni, Sattva Tamo Bakula Abaha, Tamo Bakulo Prithvi. Relation between Triguna and Nidra also mentioned. The Rajasa Sattva pupils slept only in Artharatri, and the Rajo Bhuisha have Animita Nidra and Tamo Bhuisha, Ahasu, Nihasu, both they slept in both day and night. Nidra Hedu Tama and Sattva Bodhane Hedu. Tama have a role in Nidra. And Nidra is the combination of Kava and Tama. Chandra is the combination of Vada, Kava and Tama. Brahma is the combination of Teja, Pitta and Vada. Mocha is the combination of Pitta and Tama. Relation between Triguna and Bala, Sattva Sharirotam, Pravardam, Sahajam Badam. Here, Hemadri mentions that Sattva Shabdena, Gunatrayam Upanishadi. Kridaya is the Visheshana Chedana Sthanam, Sattvadi Dhamma Kridayam. Sattvadi Dhamma Kridayam means Triguna is reside in the Kridaya itself. Triguna and Ahara relation. In Chandogya Upanishad, Ahara, it is mentioned that Ahara Shuddha Sattva Shuddhi. That is, Sushma Amsha of Ahara turns out to be the Manas. Manas is the location of Triguna. And in Bhagavad Gita, it is well explained that Rajasahara and Tamasahara, foods that gives longevity, full of energy, bestow good health, and vigor with happiness and satisfaction are relished by those in Sattva. Such food cause pain, that is Ahara Rajasa Steshna, Dukkha Shoga, Amaya Prada, is like Rajasika food. And Tamasahara foods are like Yadayamam, Gadarasam, Pudi, Parishidamya, Uchishtamavyametam, Bhojanam, Tamasa Priyam. That is food cooked more than 3 hours before, that is cold, tasteless, without aroma, like that, is categorized under Tamasahara. And definition of Sosta indicates that Samadosha, Samadhisha, Samadhadu, Malapriya, Prasanna Alpendriya, Mana, Sosta, Ityabhidhi. We all know that, and the Prasanna Alpendriya Mana is the important thing here, because we should consider Triguna while treating. And Adhisthana of Vedana, according to Charagacharya, is Manas, Dekha, and Indriya. So we should consider while treating. And importance of Manasika Pravidi. Why Manasika Pravidi is relevant? Sattvana Sattvavinyanam Hidam Aushadha Kalpana, according to Charagacharya. So Sattva Rajas Tamasam Samyavastha is the Pravidi. Any abnormality to this happens, it will cause the disturbance of the equilibrium of the body and mind. So we can consider tolerance capacity. Sattva Pravidi, good tolerance. Rajasthan, with the help of others, they can tolerate things. Tamasam, low tolerance. And Triguna and therapy, we can correlate Sattviga therapy, work through quality like love, peace, non-violence, mantra, etc. Rajasiga therapy, like quality, like energizing, stabilizing, immediate shock, and like that. Tamasika therapy, sedation, therapy can be included in Tamasika therapy. Pathological certain diseases involving in Triguna, in Navasmara, Rajastamobia, Rajastamas and involved, Adatwa Vinivesha also, Rajastamas involved, in Unmadam, Thai Alpha Sattosya. Involved, Mocha Mada, Rajo Mohavardamana, Mocha and Mada occurs. And we can correlate Triguna with the ID, ego, and super ego of Sigmund Freud's theory, personality. ID can be correlated to Tama, ego can be with the Pitta, Rajas, and super ego, Sattviga. And modern analysis, we can correlate with organ of mind, in prefrontal cortex, emotions of memory, all are situated there. Memory, social behavior, planned actions, and all, limbic system, and organ of mind we can correlate. Maybe we can correlate with Triguna. And definition of Apta itself includes Rajastamobium, Nirmukta, Apta. Rajastamobium, Nirmukta persons are known as Apta. So, Satyam Vashanti Tekasman, Nirajastama. Without Rajas and Tamas, they they become the Apta people. So in conclusion, Tridoshas are Vata Pitta Kama, basic humors of the body. Trigunas are Sattva Kamas, mental humors, and complete health. For complete health, we should consider the mind also. The Trigunas preserve the mind and maintaining it in a healthy state. Any disturbance in this equilibrium result in various types of mental disorders. These are the references. Thank you.
Thank you, Dr.
Thank you,
Devyani.
Dr. Devika.
Thank you.
So next I invite Dr. Vashishth Gohel for the presentation.
Yes, ma'am. Yes. Am I audible?
Yes, doctor, you're audible.
Okay, yeah, sure. That's fine. Yes, my screen is visible.
Yes, doctor.
Good evening, everyone. My name is Dr. Vashishth, and today I'm going to present Guduchyadi Krushra as Ahara Aushadh in sickle cell disease case. So the case summary was a diagnosed case of sickle cell disease was managed in OPD level with the administration of Guduchyadi Krushra as palliative care, along with ongoing allopathic medications for 30 days, which shows significant improvement in the patient's quality of life. So the patient description, like a 12-year-old female patient was diagnosed with sickle cell disease at the age of 3 years. She arrived at our hospital with complaint of fever on and off, severe pain in joints, limbs, and abdomen, anorexia, weight loss, and generalized weakness. She was already receiving allopathic treatment for the same condition. So when patients arrived at our OPD level, her baseline finding was pala was present, ictus was not present, edema having non-beating edema, lymphadenopathy was present. Her WHO QOL parameters is for general assessment 7/15, physical assessment 7/20, psychological assessment 8/10 and 3/10, and social assessment 7/15, environmental 12/15. As the sickle cell anemia or sickle cell disease is not at all curable disease, and as it is genetic disease, so for treat the disease is not at all possible right now. So for that, we are assessing only WHO QOL, that is quality of life parameters. So her investigations before treatment, there will be fetal hemoglobin, that is 29.4, and HPS of the patient was non-case of sickle cell disease. Stop all the Ayurvedic medicines for the better result. So only Guduchyadi Krushra has been administered for 1 month only. Simultaneously, we are giving them allopathic medicines, as the allopathic medicines is standard protocol. So we are not at all permissible to stop at any cost. So for that, we are only having a Guduchyadi Krushra. So findings after giving Guduchyadi Krushra. So in Guduchyadi Krushra, we have included Guduchi, Amalki, Haritaki, Likatu, and Shigru. We have added these drugs in 25 gram of rice and 25 gram of mudda and prepared Krushra. We have given this Krushra for 30 days in alternate manner, like for 1 day it is in morning or afternoon or in evening or at night. So after findings after giving Krushra, the pallor was reduced. After treatment, there is no edema, and lymphadenopathy, there is no lymphadenopathy was present. So WHO parameter, QL parameters, we have seen very drastic change in QL parameters rather than diagnostic parameters. So the comparison of before treatment and after treatment, on day 1, the QL score was 44 out of 85, with HBF was 29.40 and HBS was 69.70. And after 30 days of treatment, of the QoS score was significantly changed from 44 by 85 to 58 by 85, where will be mild changes in the hemoglobin electrophoresis, which includes HbF of 30.40 and HbS was 68.70. So the conclusion was, as our science has said that Ahara iti Mahabhaishujam. So Ayurvedic science that provides a framework for diet-based management of sickle cell disease and its crisis or sinus symptoms. After administration of Guduchyadi Krushra, as that protocol only, there were not significant changes in hematological electrophoresis, but highly significant changes in the quality of life of sickle cell disease patient. So these are the details of the patient and preparation. Thank you.
Thank you, doctor. Next, I invite Dr. Surekha Vasant. I invite Dr. Surekha Vasant. Doctor, please unmute and reply. Dr. Surekha.
Good evening, ma'am.
Good evening, doctor.
Dr. Surekha, please start the session, doctor.
Good evening, everyone. My name is Dr. Surekha Vasant. My today's topic is efficacy of Manjushtadi Siddhagruta Ashtrotan in Shushka Kshipak with special reference to Raya syndrome. Introduction. Welcome to today's presentation on the efficacy of Manjushtadi Siddhagruta Ashtrotan in Shushka Kshipak with special reference to Raya syndrome. As we divide into this topic, it is important to note that Raya syndrome affects millions of people worldwide and significantly impact their quality of life. Symptoms of Raya syndrome are burning sensation, itchy eyes, red eyes, blurry vision, heavy eyes, dryness sensation. Through our research, we aim to shed light on the potential benefit of using Manjushtadi Siddhagruta Ashtotana as a treatment option of dry eye syndrome. Our findings could pave the way for more effective and accessible treatments for those suffering from this condition. संप्राप्ति सिरानुसारिभि दोषे विगुणे सिरानुसारिभि दोषे विगुणे उद्मगागते जायन्ते नेत्रभागेषु करुणादारुणासु श्रुतुत्रस्तान् विशेष संप्राप्ति for Sukshakshipag can be considered as follows. दोष वात दोष प्रकोप हेतु सेवन वात दोष प्रकोप aggravation of vata dosha वातदोष सीरानुसारन नेत्र प्रदेशी संश्रय स्थान संश्रय शुष्क क्षिपक dryness of disease. Objective, primary objective to study the effect of Manjushtadi Siddhagruta Ashtotana. Second, to compare effect of Manjushtadi Siddhagruta Ashtotana and eye drops of carboxymethyl cellulose in Sukshakshipag. Secondary objective to study the Sukshakshipag and dry eye in details, to study the Ashtotana Kriyakalpa in detail. Methodology, inclusive criteria satisfied, exclusive criteria, essential assessment, counseling of patient selection by simple random sampling method, informed written consent, follow-up with assessment, data collection and statistical analysis of data, final conclusion. Operational definition. Sukshakshipag Ashtotana. Dry eye. Dry eye is a disorder of tear film due to tear deficiency or excessive evaporation, which cause damage to the impalpable ocular surface and material and methods. Material Manjishta, Maduk, Sariva, Laksha, Lodra, Dharvi, and Grita. Gogrita. Preparation of drug, standard operation procedure, SOP of Manjishtadi Siddhagruta Shrutana. Step 1. Kalkat Chaturguni Krutya Grutam Va Telvaimava Chaturgune Draves Sadhyam Sharindar. Manjishtadi Siddhagruta will be prepared in the GMP certified Ayurvedic pharmacy according to the classical text. Step 2. Ashrotan Vidhi Purvakarma under all aseptic precaution Ashrotan will be done. Drug Manjishtadi Siddhagruta route of administration local Kriyakalpa Ashrotan dose 1 drop for twice daily twice duration 21 days. Darvi Siddhagruta SOP of it is same as above. Manjishtadi Siddhagruta contain Darvi and Gogrita Kriyakalpa Ashtrotana route of administration local dose 1 drop twice 2 times a day duration 21 days. Result the study found that Manjishtadi Siddhagruta Ashtrotana is an effective treatment for dry eye syndrome. The group receiving the treatment showed a significant improvement in symptoms compared to the control group. Additionally, the study found that the ingredients in Manjishtadi Siddhagruta Shrutana have anti-inflammatory properties which may contribute to its efficacy in treating dry eye syndrome. Risk of study in this treatment, there are few chances of irritation of eye, lacrimation of eye, burning of eye. If any of these happen, then treatment will be given. Conclusion. In conclusion, the study has shown that Manjishtadi Siddhagruta Ashtratana is promising treatment option for dry eye syndrome. Its efficacy has been proven through rigorous research methodology and the results are significant. It is important to continue studying this treatment option and exploring its potential benefits. This can lead to better treatment option for those suffering from dry eye syndrome. We encourage further research and collaboration in this field. Thank you.
Thank you, Dr. Surekha. Next, I invite Dr. Jyoti Shitole. I invite Dr. Jyoti. Dr. Jyoti. So next I invite Dr. Faisal Arif Khan. I invite Dr. Faisal Arif Khan.
Dr.
Okay,
Faisal
so
Arif Khan, are you there?
now I invite Dr. Shivani Dadaso Gaude. Dr. Shivani. I invite Dr. Shivani Dadasao. Now I invite Dr. Krishnaja. So now I invite Dr. Sonali Kharde. Dr. Sonali.
Next, I invite Dr. Reksha J. Udupa for the paper presentation. Dr. Reksha, Dr. K. Reksha J. Udupa, are you there?
Yes, I'm there.
Please share the screen, doctor.
Okay. It's saying unsupported document.
1 second, doctor. I will share for you.
Yeah, sure. Thank you.
Please start the session, doctor.
Okay. So my topic is on conceptual study on diabetic retinopathy. Contents, introduction, prevalence, classification, risk factors, idiopathogenesis, signs and symptoms, management, Ayurvedic aspect, and conclusion. Introduction. Diabetic retinopathy is a vascular disorder affecting the microvasculature of the retina. This condition affects third of all diabetic patients and its prevalence increases with the duration of diabetes. Prevalence. Prevalence of diabetic retinopathy is higher in non-insulin dependent diabetic mellitus patients, about 40%, than in non-insulin dependent diabetic mellitus patients, 20%. Recent survey estimated that there are more than 40 million diabetic mellitus patients in India. Presently, 5.6 million subjects have diabetic retinopathy and expecting 79.4 million at 2030, posing great impact on public health, which has to be effectively managed. Hemorrhage is one of the most common features in diabetic retinopathy right from early stage, which may cause gross visual impairment and further lead to advanced eye diseases like retinal detachment. Diabetic retinopathy. Diabetic retinopathy is the most common diabetic eye disease, which is caused by changes in blood vessels of retina. In this condition, either there will be abnormal new blood vessels on the surface of the retina or swelling and leaking of blood vessels. It is a chronic, progressive, potentially sight-threatening disease of retina. Classification. Non-proliferative diabetic retinopathy, which has stages like mild, moderate, severe, very severe. Proliferative diabetic retinopathy, which is the advanced stage. Diabetic maculopathy, clinically significant macular edema, advanced diabetic eye disease. Risk factors, duration of diabetic mellitus, age of onset, poor metabolic control, heredity, pregnancy, hypertension, smoking, obesity, and hyperlipidemia. Etiopathogenesis. In diabetic retinopathy, there will be loss of intramural pericytes, thickening of basement membrane, and progressive closure of retinal capillaries. The initial loss of pericytes leads to formation of dilatations of the vessel, seen as microaneurysms, and a breakdown of blood-retinal barrier, allowing the leakage of vascular contents into the surrounding tissue. Edema is present around such areas as well as hard exudates in small, localized deep hemorrhages known as dot and blot hemorrhages. In addition, there is an increased aggregation of platelets causing capillary non-perfusion. Extensive closure of capillaries leads to ischemia of the retina. The body attempts to re-establish blood supply by opening up the shunt vessels, intraretinal microvascular abnormalities, or by elaborating vasoproliferative substances such as avascular endothelial growth factor that lead to neovascularization at the border between well and poorly perfused retinal areas. This neurovascular tissue is more friable, bleeds easily, and incites a fibroblastic response. Symptoms: blurred vision, fluctuating vision, sudden loss of vision, floating spots. Signs: microaneurysms, retinal hemorrhages, hard exudates, cortical spots, intraretinal microvascular abnormalities, dot and blot hemorrhages. These are the signs: the microaneurysms, IRMA, hard exudates, cortical spots, flame hemorrhages, dot and blot hemorrhages. Management. The key to proper management of diabetic retinopathy patients include prophylaxis by controlling blood sugar and periodical screening of retina, prompt referral for early detection, prevention of progression by appropriate use of laser photocoagulation, surgical correction of various anatomical abnormalities, low vision aids, and rehabilitation measures in patients with severe visual loss. Continuous attempts have been made to find systemic drugs which could reduce or arrest occurrence and progression of diabetic retinopathy. Antiplatelet therapy, lipid reduction, laser photocoagulation, pan-retinal photocoagulation, peripheral retinal cryoablation, vitrectomy are the treatment adopted usually. The judicious use of laser photocoagulation at the appropriate time has vastly changed the prognosis of diabetic retinopathy. Ayurvedic review, Netra Parikshaka has mentioned Granthi and Meharoga as the cause of eye disease. Netra Upadeha is a Purorupa of Prameha. The dominance of Bahudraha Sleshma greatly disturbs Alochaka Pitta by increasing its dravatva. This samprapti results in Kapaja Raktapitta or Urdhvaka Raktapitta. The changes in the blood vessels of the retina can be understood by the concept of Dushti. Ati Pravriti, neovascularization. Sangha can be correlated to the retina vein or artery occlusion. Vimarga Gamana can be correlated to the exudates in retina. Sira Granthi to microaneurysms. So, Lakshanas of Timira and diabetic retinopathy, Pratama Patalagata Timira with Avyakta Rupa Darshana can be correlated to the blurring of vision. Vitya Patalagata Timira, Mandalaniva Pashyati, that can be correlated to the Srotas impaired color vision. Tritiya Patalagata Timira, Saditaniva Vasasa can be correlated to the distorted vision or fluctuating vision. Chaturtha Patalagata Timira, Tamasa Darshana can be correlated to the painless gradual loss of vision. Chikitsa, Agni treatment, Sroto Shodhana, Raktapitta Shamaka, Avarana treatment, Dhatukshaya treatment, Vatanulomana, Kriya Kalpa, Shamana Aushadh. In conclusion, diabetic retinopathy can be considered as Prameha Janya Timira. Ayurvedic therapies like Takadara, Bidalaka, along with internal medicines have shown significant result. Due to Vyadhi Chirakari Sambhava and Krishra Sadhyatva, it is difficult to completely reverse the underlying pathology in short duration. Thank you.
Thank you, doctor.
Next, I invite
Dr.
Dr. Anandakumar
for the presentation. Dr. Anandakumar, are you there? Hello, Dr. Anandakumar, are you there? Please unmute, doctor.
Sir.
Hello, doctor. Please
Hello.
share the screen, doctor.
Sure. Hello. Sir, there is a problem in sharing. Can you share for me?
Okay, doctor, I will share for you. Just a second, doctor.
Yes. Hello. Hello.
Doctor, please
Yes,
start.
doctor.
Good evening, ma'am. Am I audible?
Yes, doctor. Good
Yes,
evening.
doctor,
Please
audible.
start.
Please
evening,
start
ma'am.
the session.
Myself, Dr. Anandakumar from Ashwini Ayurveda Medical College, Davangere. My topic is forearm fracture. Forearm consists of two bones, that is ulna and radius. Forearm laterally there is a hello.
Doctor, you are audible. Please continue.
Yeah, madam. Thank you. There are two bones of the forearm with a radius and laterally and ulna medially, which have important role in positioning of the elbow and wrist joint. The ulna has stabilizing role while the radius helps in supination and pronation. Introduction of forearm fracture. The forearm fracture is break in the radius and ulna in one or both bones at one or several parts of the forearm. Signs and symptoms. Usually patient presents with bruising, swelling, deformed forearm, and patient enters the clinic by supporting the affected forearm with his normal hand. On examination, he may not allow to touch the hand by severe pain, and there is a tenderness present and crepitus will be present. And while doing examination, check for radial pulse, which may be absent in vessel damage, and finger movements, which may be absent in tendon or nerve injury. Usually, it's diagnosed by X-ray, simple X-ray, that is AP and lateral view. Classification. The fractures can be classified as simple as closed fracture, compound or open fracture, and incomplete fracture or complete fracture. In forearm fracture, there are several. You can classify it as distal 1/3 of forearm fracture, middle 1/3 of forearm fracture, and proximal 1/3 of forearm fracture. So there are 7 types of fracture here. In the distal 1/3 of the forearm, there is a Colles and Smith fracture. Colles fracture happens when we fall on the outstretched hand, that is Fuchs injury. And Smith fracture is opposite to the Colles fracture, that is inward movement. We fall on the inward hand. And there is a Monteggia fracture. Monteggia is the fracture of the shaft of the radius with, Monteggia is the fracture of the ulna fracture with radial dislocation. Gillespie is the fracture of the radius with distal ulnar joint dislocation. And Barton fracture. Barton fracture is the fracture of the distal end of the radius with articular surface. And at the medial, at the proximal part, we have fracture of coracoid process, fracture of olecranon process, and fracture of head of the radius. Treatment. The treatment is 2 types, that is operative and non-operative. In non-operative procedure, in undisplaced fracture, we use cast for 6 to 8 weeks. We have to use cast. And in operative, there is a method that is ORIF, that is open reduction with internal fixation. Open reduction with internal fixation, we can have both with bone grafting and without bone grafting. Without bone grafting is used in displaced 2/3 of the ulna and proximal 1/3 of ulnar fracture and both fracture bones. ORIF with bone grafting is indicated in bone loss with open injury or non-union or malunion. And there is another surgical procedure, that is intermedullary nailing. It is indicated in poor soft tissue integrity, unstable and irreducible fractures. And external fixation is also useful in a open fracture and in burns. But in burns, we can go for external fixation with in open fractures. The complications. Sir, can you scroll it? Yes, there is a early complication and late complication. Early complications include peripheral nerve injury, blood vessel injury, pulmonary or fat embolism, and infection. And late complications are non-union, malunion, radioulnar synostosis, uneven limbs. And in the Colles fracture, there is a deformity called dinner fork deformity. As per Ayurveda, Sushruta explained the different method of reductions in the Chikitsa, Sushruta Chikitsa of Sushruta Chikitsa. That is, one is Seka, Lepa, and Patya. Seka with Negrodadi Gana Kashaya, it is indicated in Pitta Prakruti. And Seka with Kshira and Lagu Panchamula Kashaya, that in Vataja conditions, that is very painful condition, we can go for Kshira and Lagu Panchamula Seka. Lepa with Manjishtadi Lepana. And Patyahar, Grutayukta Kshirapana processed with Kakolyadi Ganadravya and Laksha, Shali, Mamsarasa, Kshira, and Sarpi. In Ayurveda, the principles of close management of the bone and joint injuries have been explained. Though modern medical science has gained excellence in the management of fractures, Ayurveda, along with technical management, adopts other modalities like Panchakarma, Abhyanga Chikitsa, Abhyantara Chikitsa, Bahya Chikitsa, Patya, Apatya, etc., which helps in enhancing the fracture healing process. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Sonali Khade for the paper presentation on the topic role of Gandhak Rasayana along with Kabur mixed Nimbathaila. Dr. Sonali, are you there? Dr. Sonali, please unmute, doctor.
Hello.
Hello.
Hello. Good evening, sir.
Good evening, doctor. You are audible. Please share the screen, doctor. Hello, Dr. Sonali.
Yes, sir. Give me a sec. Sir, can you do this for me?
Okay, doctor. I will share for you. Please start the session, doctor.
Good evening, everyone. I'm Sonali Babasaheb Kherde. I'm doing Rasa Shastra and Vaishya Kalpana MD in SVNST Ayurved College, Rauri. My topic is role of Gandhak Rasayana along with Kapur mixed Nimbathail. The first thing whenever we see a person is skin. Skin is the largest organ of body. Acharya mentioned all skin diseases under Kushta. There are two types of Kushta, Mahakushta and Kshudra Kushta. So I decided to took this topic. My aim of the study is to study the efficacy of Gandhak Rasayana along with Kapur mixed Nimbathail in treatment of Dadru. Next slide, please. Okay. The case I took this, there is a patient. Chief complaints are elevated irregular rashes, severe itching, severe burning sensation, severe redness on thigh area. All symptoms are persist from 2 months. History is the patient came with her parents.
of elevated skin rashes over thigh in round shape associated with severe itching, severe burning sensation, and redness of skin. So these all symptoms we can found in the Drupama Vicharchika. All the three have eruptions, but they have certain peculiar set of other signs and symptoms on the ground of these. Differentiated as in Pama, there are whitish, reddish, or blackish eruptions. In Vicharchika, there are blackish eruptions along with itching, and excessive secretions are also there. There are reddish, in the Dru, there are reddish eruptions along with itching, and annular elevated patches. That's what Utsana Mandal. Study design I took is single case study. Materials and methods are the next slide, please. Materials and methods I used in this is Gandhak Rasayan 125 mg 2 tablet TDS orally with lukewarm water. Kapoor mixed with Nimbo oil applied on locally affected areas of thigh, as shown in the table. So next slide, please. There is a table for this. I gave the treatment for 7 days orally and locally. Next slide, please. Patient was advised to be hygienic and bath twice a day, clean and dry the affected area, wear cotton clothes. Observations was done as per gradation of clinical features subject to parameters. I've shown the gradation in next slide. There are gradation criteria. I took gradation before treatment and gradation after the treatment. You all can see. Next slide, please. Before treatment, there are severe itching with grade 3, Pidika with grade 2, Rag with grade 3, and Utsan Mandal with grade 3 was observed. After the completion of treatment, severe itching with grade 0, Pidika with grade 0, Rag with grade 1, and Utsan Mandal with grade 0. Mild scar are there also, round shape was present. The result, as a result, before treatment, severe itching with grade 3 was present, but after completion of 7 days treatment, severe itching at affected region decreased. 6 Pidika with grade 2 was observed before treatment, and it reduced to grade 0 with no Pidika at affected region was observed. Rag with grade 3 was observed before treatment. It was mild on 7 days after treatment. Completion and before treatment, Sanamandal at thigh region with grade 3 was observed, which was absent after completion of treatment, and they are clearly seen. So the action of drug, next slide please. Gandhak Rasayan is polyherbal drug which is Rakta Shodha, Kandubna and Rasayan mainly indicated in Kushtarog. It is prepared by giving 12 bhavnas to Kwat of Chaturchat, Trifala Shunthi with Swaras of Guduchi Bringaraj, Adrak with pure Gandhak. It has antifungal and antibacterial properties, thus it reduces the infection. It reduces feature of Raga Pidika with Rakta Shodhak and Kushtagna properties. So the conclusion is the present study concluded that the Gandhak Rasayan along with Kapoor mixed Nimbatel was effective in treatment of Dadru without any adverse drug reaction. There are some references I took. Okay, thank you everyone.
Thank you, doctor.
Doctor. Now I invite Dr. Krishnaja for the next presentation.
Am I audible, doctor?
Yes, doctor, you're audible. Please share the screen.
Is screen is visible, doctor?
Yes.
Yes, doctor, visible.
Okay. Can I start?
Yes, doctor.
Please, doctor.
Okay. Good evening, all. My topic is Agata Tantra in Vedic period. Coming to the determination of Vedic period, Period extends from prehistoric times up to 2500 BC can be treated as Vaidika Yuga. Vedas are the oldest records of Hindu scriptures. Hindu scriptures are generally classified into two types, Shruti and Smriti. It is believed to have been heard as revelation from Brahma and Rishis. These records are known as Vedas. With regards to the descent of Ayurveda, the period of transmission of knowledge from Brahma to Indra is identified as Vaidika Kala, and the latter period is considered as the starting phase of Samhita Kala. Coming to the Vedic literature, ancient Indian literature mainly consists of ritual works, historical incidents, and matter related to the preventive and curative aspects of medicine also are available in it. Vedas are the oldest record of mankind. They are four in number: Rigveda, Yajurveda, Samaveda, and Atharvaveda. Vedas are divided into four parts: Samhitas and Brahmanas, together known as Karmakanda, Aranyakas and Upanishads known as Jnanakanda. Though Ayurveda has been described as the essence of all Vedas, some opine that it is the Panchama Veda or Ubaveda. Vedas and their Upavedas. Dhanurveda is the Upaveda of Rigveda, Gandharva Veda is the Upaveda of Yajurveda, and Stabhakya Veda is of Samaveda, and Ayurveda is of Atharvaveda. Status of Ayurveda during Vedic period. In Charanavyuha and works of Shankara, Ayurveda is considered as Upaveda of Rigveda. Sage Kashyapa mentioned it as a Panchama Veda. Acharyas of Vedic period, Brahma, Draksha Prajapati, Ashwinis, etc. Evolution of Ayurveda from pre-Vedic to post-Vedic period. In pre-Vedic period, it transmitted from Brahma to Daksha Prajapati, Vedic period Ashwini to Indra, and post-Vedic period it is from Bharadwaja to Atreya. Agadatandra in Vedas, synonyms of Visha is Madhavadi and Dushtanu. Two types of Visha were mentioned there, Stavara and Jangama. Visha Prabhava as Visha produces Daha, Vrana, Mada and Murcha, etc. Visha Aushadhas were Surya is mentioned as a detoxifier. Virut known as Madhu detoxifies Sarpa, Vrishchiga, Mashiga, Visha. Paidwa is a Sarpa Vishanashaka Aushadha known as Ahiknya. Taudi is a plant which is Vishanashaka. Types of medicines used during those periods. Ayadi comes to a person affected by a disease. Parayadi is a medication taken as raw. Ashugnadi is a powdered medicine, and Pimshadi is a well-grinded or smashed medicine. It signifies the method of practice prevalent during the Vedic era. The glimpse of Pimshadi Kalpana is seen in a medicine called Villuadi Agada in Visha Chikitsa. Swarasa of Varnavadi plant is mentioned as Tavara Vishasamana. Sarpa, Vrishchiga, Kida, Patanga, Krimi, etc. are eaten by Shabundika. There is a reference regarding praising Garuda, as Garuda eats toxic creatures. Sarpa Vedas, Asida, Tirastiraji, Vridagu, Swaja, Kalmasha Griva, Shitra, etc. are Sarpa Vedas. Sarpa Vishanashaka Aushadhas are Darba, Soji, Karunagam, Ashuvara, etc. Use of chanting mantras for treating Sarpa and Vrishchiga Visha is also mentioned in Vedas. Atharva Veda contains many charms against poison of snakes, scorpions, insects, and plants. Atharvan charms are to be accompanied by the practice of Kaushika Sutra. According to Atharvan conception, there is poison in fire, in sun, in earth, and in the plants. Poisonous plants are found on mountains. Snakes like Kasarnila, Shvitra, Asida, Retharvi, Pritagu, etc. are poisonous. Kangaparvan, Sarkoda, Vrishchiga, and Babru are terms for scorpion in Atharva Veda. Its poison is in its tail. Mashagas or biting insects are also poisonous. Atharva Veda thinks of the ants, Ubajika, and particularly water produced by them as an efficient antidote against poison. Kandavisha seems to be some poisonous root. Clear reference of poisoned arrow can be seen. Ashwins killed the son of an asura with poisoned arrow. Rigveda also has the hymn against snake poison, and scorpions are venomous vermin. In Rigveda, Visha and Visha Chikitsa are seen as Samvada. Dialogue gives an awareness about snakes and their nature. Snakes were considered as holy creatures and were to be worshipped. Mantras were chanted to pacify their poison. As we move to the later literature in Veda, we can see the mentioning of animals, which are natural enemies of snakes. Praising chants of Nagula, Mayura, Garuda are seen repeatedly. They were also reared at home for safeguarding people from snakes. In Rigveda, there is a reference of Vishakna Upanishad by Agastya Maharshi in first mandala. Agastya Maharshi, who was afflicted by poison, chants about 8 mantras to get detoxified. Jala is the source of origin for Visha and surprisingly a remedy too. In a glance, the Visha Chikitsa which we see today is built on the foundation led by the knowledge of Veda. Many principles of Vishachikitsa in the text are based on the Vedic literature. Veda are considered as mother for all Shastra. These are my references. Thank you.
Thank you, Doctor. Next, I invite Dr. Suhani Naik for the paper presentation. Dr. Suhani Naik, are you ready?
Hello. Yes, sir.
Doctor, are you ready for the presentation, Doctor?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Can you share my PPT slides, please?
Okay, just a moment, Doctor.
Yes.
Okay, please start the session, Doctor.
Hello, good evening, sir. Myself, Dr. Swani Chandra Singh Naik, PG scholar. My topic name is review on pharmacokinetic and pharmacodynamic action of Gandhak Rasayan. Next slide, please. Introduction. Gandhak Rasayan is described in Yog Ratnakar under Rasayan Adhikar. Gandhak Rasayan work on Pittadhara Kala, which act as Rasayan and enhance the Jatra Agni. In the Falashruti of Gandhak Rasayan, Yog Ratnakar describe the following diseases like Kushta, Atisar, Grahani, Jirnajwar, Prameha, Vishadosh, Vat Rakta, etc. Also, Yog Ratnakar said that if you consume Gandhak Rasayan for continuous 6 months, then it will become Sarvarogar for us. So in this paper presentation, I will put hypothetical view on explaining how Gandhak Rasayan will work in certain selected diseases. Next slide. Rasayan and its benefits. The word Rasayan means which support the Ras. The word Rasayan made up of Ras and iron. The meaning of Ras is purest form of Ahara, while iron means way, going, circulating all over the body. Rasayan means enhance the memory, promoting intellect, prevent the disease, optimum health, enhance the complex, better voice, optimum strength of the body and sense organ, Vak Siddhi, what he say become true. Popularity, brilliance, increase the longevity. Next slide, please. Material and method. We have used Sahita and article which are published for reference purpose. Gandhak Rasayan is explained in Yog Ratnakar under Rasayan Adhikar. Pure Gandhak is titrated with Godugdha for 8 times. Decoction of Chaturjat, Guduchi, Triphala, Shunti, Bringraj, each of them have 8 bhavna separately. Lastly, 8 bhavna of Adrak Swaras is given. Total 96 bhavna is given. Next slide, please. Thus, process for 96 times, which various herbal drugs are added with sugar at last. The magical formulation called Gandhak Rasayan gives us tremendous therapeutic effect in curing and preventing purpose for enlightenment. This is the Khalavya Rasayan Kalpa. It is useful for the breaking of specific Samprapti stages and to reduce the symptom and suffering. To enhance the potency and gamitva of drugs, it is given with Amalki Kvat, Guduchi Kvat and Sharkarajal as an Anupan. Bhavna. Bhavna is one type of sanskar which leads the transformation of drugs in many ways. Bhavna is defined as a procedure in which the powder drug are mixed with some specific liquid and are titrated to dry by itself. It helps in potenting the substance which show desired effect in very low doses. Duration is one bhavna required minimum 3 days, 24 hours, 8 hours per day. Next slide, please. Study design. Pharmacokinetic action of the Gandhak Rasayan and pharmacodynamic action of the Gandhak Rasayan. Dose is 2 gunja to 4 gunja, nearly 250 mg to 500 mg. Route of administration is oral. A review and study on pharmacokinetic action of Gandhak Rasayan. The Rasa, Vipak, Virya, Guna and Karma and pharmacokinetics of drug are separately explained are as follows. In table, Gandhak Ras has Madhur Kata, Vipak is Katu, Ushnavirya, Kushtagnan, Krumigna Karma, Swakam, Tiktaras, Katu, Vipak, Ushnavirya, Rukshalagu Gun, Deepan Pachan Karma, Ela, Katuras, Katu, Vipak, Ushnavirya, Lagu Rukshagun, Deepan Pachan Karma, Tamal Patra, having the Madhuras, Katu, Vipak, Ushnavirya, Tikshna Lagu, Deepan Uttejak Karma, Nakeshar having Kashayaras, Katu, Vipak, Ushnavirya, Rukshagun, Deepan Sangran Karma. Guduchi has Katutikta Kashayaras, Madhur Vipak, Ushnavirya, Lagu Gun, Rasa and Balle Sangrai Karma. Haritiki has Pancharas except Lavan, Madhur Vipak, Ushnavirya, Rukshagun and Rasa and Anluman Karma. Next slide, please. Divitaki has Kashayaras, Madhur Vipak, Ushnavirya, Ruksha Lagugun, Vedan Karma. Amalki having Amla Madhur Kashayaras, Madhur Vipak, Shita Virya, Ruksha Guna Rasa and Karma. Shunti having Katuras, Katu Vipak, Ushna Virya, Lagus Nigdagun, Grahi Pachan Karma. Bringraj having the Katuras, Ushna Virya, Tikta Ruksha Guna and Balle Rasa and Karma. Adrak having Katuras, Madhur Vipak, Ushna Virya, Tikshna Kuru, Gun having Deepan Vedan Karma. Sita has having Madhur Ras, Madhur Vipak, Shita Gun and Shukra Karini Karma. Gogdugda having Madhur Ras, Madhur Vipak, Shita Ushna, Nigda Guru Guna and Balla Medya Shukral Karma. Next slide, please. Review and study on pharmacodynamic action of Gandhak Rasayan. In Kushta, 3 dosh are whited, but the Kapha and Pitta dosh predominantly along with the Rasa and Rakta type of Kushta like Vichar, Chika, Pama and Dadru. Gandha, Kushna, Viryatma and Katuras Vipaki so act as a base Kafagna and Kledagna. Bhavana Dravya has property of Madhura, Shita, Virya, due to which they act as a Pittagna and Rakta Prasadan and help to cure the Kushta. The drugs which are formulating in Gandhak Rasayan are of Katutikta Kashayaras predominant, which break the sampropti of Kushta. Atisara, the drug present in Gandhak Rasayan, that is Shunti, which is Grahi, helping Atisara. Katutikta Ras of Twakaila, Tamalpatra, Nakesh improve the Deepan and Pachan Karma. Gandhak and Guduchi act as a Rasayan and Balla. Next slide, please. Grahani, Gandhak Rasayan reduces the Agni Mande, which is positive factor of Grahani after formation of Shukta Pak due to Agni Mande. It is useful by Deepan and Pachan Gun of Shunti, Twakaila, Nakeshar and Bringraj. The drug Bringraj work on Pittadara Kala. It improves the digestive work. Because of this property, Bringraj play important role in Grahani. In Pramya, all 3 dosh are whited, but in the Kapha is predominant. The main factor during Samprapti are Kleda Kapha Dushti, Dhatu Agni Manda, Dhatu Shetilya and Kled. Most of drug in Gandhak Rasayan are Katutikta Kasharasatmak, Lagu Rukshugunatmak, Ushna Viryatmak, which help to destroy the Samprapti of Pramya. Deepan and Pachan Karma of Gandhak Rasayan reduce the Dhatava Agni Manda. Due to Rasayan Karma, Gandhak Rasayan reduce the Dhatu Shetilya. Gandhak Rasayan contain drug like Guduchi, Trifala act as a etc. which reduce the Kled. Next slide, please. Observation and result. In case of Kushta, Gandhak acts as an antimicrobial, antifungal, Kafagna and Kledagna properties. Other drugs are Katutikta Kasharas, which reduce the predominant Kapha and Pitta dosh. Also, the substance having property like Ruksha, Lagu, Ushna has effect to decrease the whitehead, Kapha and Kled in the maintain the proper functioning of Dhatva. In case of Atisar, Shunti acts as a Grahi, which is due to its Ushna, Virya and Katuras. Gandhak reduces the Darubalyam. In case of Grahani, Gandhak and Bringraj play important role on Pittadara Kala. Other drugs like Shunti, Guduchi, Adrak improve Deepan and Pachan Karma. In case of Pramya, Gandhak Rasayan reduce the Kleda Kapha Dushti as well as it increases the Dhatva Agni and repair the Dhatu Shetilya. Next slide, please. Conclusion. Gandhak Rasayan which act as a Rasayan because in this Kalpa using 96 Bhavana, particle size becomes smaller which enter to all Sushma Srotas with the help of Anupan and act on Dhatu, Dosh, Mala. Lastly, added sugar, which act as an energy source to reach the drug on their targeted organ and system. Conceptually, it is concluded that the substance having property like Ruksha, Lagu, and Katu and Ushna has the effect to decrease the whitehead, Kapha and Kled, also maintain the proper functioning of Dhatva Agni. All karmas related to Chikitsa are in one dosage form like Vyadhi Pratyanic Dravyas and Yogvahi Dravyas. As described here, the hypothetical studies, clinical studies needed to find the efficacy of Gandhak Rasayan. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Renuka Deepak for the poster presentation. Dr. Renuka, are you there?
Yes, sir.
Doctor, please share the screen, Doctor.
Okay, 1 minute. Shall I start, sir?
Sure, Doctor, please start the session.
Good evening, all. Myself, Dr. Renuka Deepak Sevlikar. I'm PG second year Shalakya student from Dr.D.Y. Patil Ayurvedic College, Pimpri, Pune. In the day-to-day life, there are many cases of dry eyes and CVS are rising. So there is a need of eye exercise like eye yoga, just like a yoga for the healthy lifespan. In my poster, I present the eye exercise for the healthy eye health. First one is the palming. Palming is the yogic eye exercise, suggesting the relaxing the eye muscles around the eyes and reduces the eye fatigue. In which we have to warm the both of the hand by rubbing itself and then gently pushing the gently put the palm on the eyeball and just rotating clockwise and anti-clockwise for the just 1 to 2 minutes. It is very relaxing. It is very relaxing for the eyes. After that, blinking is the gently close the eyes, fully count 1 to 2, and squeeze the lid together. Then after that, count 1 to 2, open the eyes and count 1 to 2. Repeat exercise for the 5 times. It is very helpful for the lacrimal fluid or in the case of the dry eyes condition in which the CVS and dryness is increases day to day life due to the condition of continue screening time. After that, my third exercise is the figure of 8. Focus on an area on the floor around the 8 feet away. Move the eyes in the shape of a figure 8 and trace the imaginary figure 8 for 30 seconds. Then switch the direction. This is also the helpful for reducing your eye strain and also increasing the eye concentration or focusing the particular object. After that, 20-20 rule. For every 20 minutes, a person look at a screen. They should look at something 20 feet away for a 20 second. This is very useful exercise for the patient who is doing who having a screening timing more than 8 hours. In the IT field work patient just need to do this 20-20 rule exercise for relaxing the eyes. After that, near and far focus. Put the thumb in front of your face at about 10 inches distance and focus on it. Now the focus on the something else that is your surrounding 10 to 20 feet away. Switch between near and far, focusing repeatedly over a period of time 2 to 3 minutes, just as shown in this figure. 10 to 20 inches, just put a thumb in front of your face, and after that, same focus will be shifted on the 10 to 20 feet of the object, and then after this is repeatedly doing for 2 to 3 minutes. It should be helpful for the relaxing the eyes and the conditions of various diseases like the CVS and dryness of the eyes, which is rising in currently rising conditions. Thank you.
Thank you, Doctor.
Thank you, Doctor. Next, I invite Dr. Vidya K for the paper presentation on the topic A Case Study on Parikartika. Dr. Vidya, are you there?
Yes, sir.
Please
So
share the
shall
screen, Doctor.
shall I share my okay.
Your screen is visible, doctor. Please start the session.
Good evening, all. Myself, Dr. Vidya, third year PG student from the Department of Shalyatantra. My topic is on case study on Parikartika. The introduction, the Vyadi Parikartika has been described in Charaka Samhita Siddhisthana, chapter 7, in Niruha Basti Vyapat, and Shushrisa Samhita has also described the disease. It has also been described in the complication of Garbhini in the Kashyapa Samhita Kilasthana. In my case presentation, the patient ABC, gender 29 years, female. She is a housewife and vegetarian. The patient examination, her nadi was 72 per minute. Jiva, Kshuda, Truna, Nidra, Bhuta, everything was Prakrita. And Mala once every alternative day with pain and itching at anus and stool passage with blood streak sometimes. And Udara Pariksha is also Prakrita. And Sthanika Pariksha, there's a redness and itching at the anal region with a few tiny cracks at the anus. And the menstrual history, the regular 4 to 5 days cycles per month, 30 days regular monthly cycle, one child, she has one child, and operated for LSAs. In the past history, the patient had suffered for the fissure problem during the pregnancy and also after the delivery about 2.5 years back. The problem resolved after the delivery by taking medications. The symptoms, the patient used to strain during defecation. Due to the constipation, she had the tendency of defecation every alternative day, and there was a painful defecation along with itching. And sometimes blood streak was also there. What are the hetus? Nidhanas. Nidhanas are excessive and frequent intake of viruddha aharas, like sprouts, and 4 to 5 times a week, and low intake of liquid and dislike for ghee and fruits, frequent outing and consumption of Chinese food, like she used to have the Chinese foods. In 15 days, during fasting, frequency and heavy intake of rice, sagu, etc. The samprapti of Parikartika is Srota Vaigunya, and that leads to Ushna, Rukshna, Vishtambi, Ahara, Sevana. By this, the lifestyle causes the constipation, and by straining during the defecation, there's a pain, itching, redness, and cracks at the anus with blood streak in the stools. That causes the Parikartika. The above mentioned causes of food lead to severe constipation, like low intake, like some nidhanas, and due to pitta and kafakara doshas, which ultimately lead to malavistamba, constipation, and then Parikartika. This causes with the favorable condition of past history of the same problem in which there was already the weakness of Purushabaha Srotas. And the review of literature, it has been said in Charaka Samhita, sprouts has been described. In Charaka Samhita Siddhisthana, Tishna Basti given in excess quantity to the person having Mrudu Koshta and Alpa Dosha results in Parikartika. In Kashyapa Samhita, he told that it is an Upadrava in Garbhini, and the treatment is given according to the Vataja, Pittaja, and Kafaja types. The main cause of Parikartika is Ruksha Guna due to Vata Prakopa and Malavaroda. The formation of Utpatti of Guda during the intrauterine life is the essence of Rakta. And in modern, it is correlated with fissure in Yeno. And what the Chikitsa we have suggested is Nidhana Parivarjana. The patient was asked to stop the food related and lifestyle related causes mentioned earlier. And Abhaya Rista Tapanakal before meals. Abhaya is a laxative, and other ingredients in the decoction help to correct the constipation. And Esti Madhu Taila. It should be applied locally at the anus, like we use the Esti Madhu Pichu. As Esti Madhu is Madhura Shita property, it is Vatanashak and Jivaniya. And it's Vrana Ropana also. And black resin, Draksha Rasa decoction. Patient is asked to make a decoction of 4 to 5 soaked black resins and drink the lukewarm decoction with a pinch of salt, that is Saindava Lavana, and ghee in her daily routine before meals. It gives excellent results correcting the constipation, as black resins does have smooth laxative property. It is also very good for Rakta Dhatu Poshaka Dravya. Patient advised to increase the intake of liquids like water and buttermilk, homemade butter and ghee to reduce the constipation. And the result in the present study, weekly assessment was done to find out the symptoms like pain during defecation, constipation, tendency, etc. Patients started getting relief from the pain and the constipation within 7 days by following our treatment. Medicines were continued for 1 to 2 months. Patient was advised to take black resin decoction for a period of 3 to 4 months. These are the before and after pics. Before it was like this and after 7 days. Discussion. In the present study, weekly assessment was done to find out the symptoms, pain during defecation, etc. and the constipation within 7 days. Medicines were continued for 1 to 2 months. The patient was advised to take black resins for a period of 3 to 7 months. Consultation regarding diet and lifestyle has given the excellent result. The conclusion, change in the lifestyle and food help a lot along the medicines in anorectal disease. Ayurveda has a result for this anorectal disease. These are all the references in Charaka Samhita, Sushruta Samhita, Kashyapa. Thank you.
Thank you,
Thank
Dr.
you.
Vidya.
Thank you.
Next, I invite Dr. Shivani Gawade for the paper presentation.
Yes, sir.
Dr. Shivani? are you
Yes,
there?
sir. Yes, sir.
Okay, doctor. Please start the session, doctor.
Okay. Myself, Dr. Shivani Dadasugaude from Yashwant Ayurvedic College, Kodoli, Kolhapur, from Shalyatantra Department. My topic is present day practice of Shar Karma in anorectal diseases. Next, please. Introduction. Shara is the best herbal extract of plants, can be prepared from combination of many herbs or maybe from single herb. It also acts on Vayated Tridosha. The prepared drug substances is called Shara because it causes Sharan, destruction of tissue, to mounts and other dhatu. Shara Karma is useful as the substitute of surgical instruments because they can be used safely on the patient who are afraid of surgery. Shara uses are excision, incision, and curettage. Next, please. Property of Shara. Rasa, Katu, Pradhan Ras, Virya, Ushna, Varna, Shukla, Guna, Saumya, Tikshna, and Agneya. Doshagnata, Tridoshagnata. Karma, Dahan, Pachan, Dharan, Vilayan, Shodhan, Ropan, and Soshan. Next, please. Quality of Shar. Good qualities, na ati tikshna, na ati mrudu, na ati shukla, slakshnatva, pichel, avishandi, shiva, and sanrigat. Bad qualities is ati mrudu, ati shweta, ati shukla, ati tikshna, ati pichila, ati vistravya, ati sandra, apakva, and hinadravyata. Next, please. Type of Shara. On the basis of administration, Pratisarniya Shara and Paniya Shara. Pratisarniya is external application and Paniya oral administration. On the basis of concentration, Mrudu, Madhya, and Tikshna. Next slide. Shara Nirman Vidhi. Pratisarniya Shara, the Panchangas of plants should be collected, dried up, and made it on small pieces. Then these are burned it with limestone. While burning, the disparate part of the plant are kept with the help of tilanala. When the ash cools down, it should be separated from the resid and limestone and basmakaran. The collected ash should be mixed with well 6 times and water of gomutra with filtered 21 in a big vessel and through a piece of clothes. Next, please. The residual portion is thrown away. The filtrate, that is, sharodak, should be kept on mandagni and stirred will until reduced 1/3. This is a mridikshar. From these 8 plant taken a mix with an shukti to make prativap. In the Heating should be continued and tripak should be mixed. Care should be taken that it not quality or too dried up. The solution thus obtained is known as Madhyam Shar. The Madhyam Shar should be heated up again and adding some Prativab Dravya such as a Danti Chitrak, Ativisha, etc. With these solution obtained with known as Tikshna Shar. Next, please. These are drugs of Papamarga and indication of Shara, Arsha hemorrhoids. Mrudu Prasvita Avghada Nichetani Sharena. Soft, spread out, deep root, and elevated type of Arshads, internal hemorrhoids. Next, please. Application of Shara, preoperative. Required instruments, proctoscope, prepared Shar, lemon juice, Alice tissue, forceps, artery forceps. Night prior to procedure, the patient advised to have a light diet afterwards, bill orally. Part preparation and enema 2 to 4 hours priority of procedure. Injection tetanus, oxomoid, intramuscular. Next, please. And these are instruments for application of Sharas. Next slide. Operative. Patient is lithotomy in position under local anesthesia or spinal anesthesia. Part cleaned with aseptic solutions. Introduced a proctoscope or Arsha yantra to anus and asepsis accesses pile mass. Pile mass should be scraped or rubbed. Next slide. Shara applied on internal piles. Wait for 100 matras, 1 to 2 minutes. Pile mass turns into the color or pakwa jambu full. Pile mass washed with lemon juice, applied yashti madhu grut and arsho yantra is removed. Rectal pack with anu tel or mahanarayan tel. Next slide. Post-operative, orally liquid after diet after 4 to 6 hours. Packing removed after 6 hours. Siege bath, Triphala Quat twice daily. Triphala Gugulat 2 tedious. Gandak Rasayan 2 tedious. Satsarkana Churna 2 grams HS. 10 ml Yashti Madhu Taila per rectal twice a day. Next slide. These are before and during after procedures of Shar Karma. Next slide. Advantages: simple procedure, mild post-operative pain, no bleeding, minimum hospitalization, no stricture formation if correct procedure is followed. Shar Karma, treating all the pile mass in one sitting, reducing the total duration of treatment, cost effective with encouraging results. Next, please. Complications: improper application of Sharas. There are bleeding, pain, stricture formation, and recurrence. Next slide. And Shar Karma in fistula and ano, next slide. These are pictures of fistula and ano. Next slide. A blind track and Shar Karma procedure. Next slide. PHK technique, a low anal fistula, Shar Karma is applied there. Next slide. And Bhagandar Pidika and with Shar Karmas. IND. Pyelonidal sinus excision with Shar Karmas. Next slide. Okay. Thank you.
Thank you, doctor.
Okay, sir.
Next, I invite Dr. Ravindra Kumar for the paper presentation on the topic Karna, Nasa, and Aushadh. Dr. Ravindra Kumar, are you there?
Yes, sir.
Okay, doctor, please share the screen, doctor.
Sir, error is coming, sir. Unsupported document, sir.
I will share for you, doctor.
Okay.
Start the session, doctor.
Good evening, everyone. Today I am going to present a Karnanasa Sandhana. Next slide. Current of the topic is introduction, Karna Sandhana, Nasa Sandhana, Aushadh and conclusion. Next slide. Introduction. Karna Sandhana is described as the Athar Sushruta in the Sushruta skill chapter. Is a very old science which can be compared with the plastic surgery or recursive surgery in recent times. And then Karma also described the Ashtanga Hridaya Uttarasthana 18th chapter. The several Siddhanta or basic principles of Sutra Samhita which are the root of the square surgery. St. Upakrama is one among these principles. St. Upakrama is the 16th type of treatment described for the wound. Sandhana Karma Upakrama is one of them. Della described the Sandhana Karma as the union of organs which are separated due to the injury to the trauma or in his commentary. Next slide. Aim of the study is to review the Sandhana Upakrama in historical or Vedic and Ayurvedic text and compare it with the present era's plastic and reconstruct surgery. Next. This is one of the example which is mentioned in the Vedic period of plastic surgery. And this the Lord Shiva at the head of the Ganesha and joins the elephant head. This is one of the example which is mentioned in the Vedic period. Next slide. Ashwin Kumar also operated and repaired the excised head by Yogyana by Rudra. Reference of plastic surgery and reconstruction in Ayurveda. Sushruta, people out of Dhanvantari has written Sandhana Karma in Sutasana second chapter. In starting second chapter, Acharya Sushruta first described the method of piercing the earlobes in infant for the purpose of decoration and giving protection from the Graha Badhas. Next slide. Definition of Sandhana Karma. Sandhanam Pranavaha Sanyojanam. Dalana has mentioned that addition of appendages of Prana is termed as Sandhana Karma. Next. These are the two methods through which Sandhana Karma will be done. Sivan Karma and Bandhana Karma. Sivan Karma is one of the 8 Shastra Karma mentioned by the Acharya Sushruta. Next slide. First one is Karna Sandhana. In older times, for giving punishment to the prisoners and wars, making unfaithful wives, amputation of nose, cutting the earlobes was done by kings. Surgeons were doing reconstructive surgeries for giving correction to them. Next slide. Method of Karna Sandhana. Acharya Sushruta stated 15 essential methods of Karna Sandhana. Next slide. These are 15 types of Karna Sandhana methods. Among 15 types, first 10 are Sadhya Karna Sandhana procedure. Next 5 Asadhya Karna Sandhana procedures. Next slide. First we are going to see Nemi Sandhana Karna Sandhana. Nemi means the flesh of wheels. Thus the Sandhana of Pali having thick, extended, equal in size should be made like Nemi, like the flesh of wheel. It is known as the Nemi Sandhana. Next slide. Next, Utpala Bedaka Sandhana. Utpala means the lotus. Bedya means the splitting. Thus, the Sandhana of union of Ayata, Rutta, Samaya, Pali should be made like Utpala Bedana. That is splitting the lotus. It is known as Utpala Bedaka. Next slide. Next Sandhana is the Valluraka. Valluraka means Shushka Mamsa. That is a dry meat or flesh. Thus, the Sandhana of Rustva, Rutta, Samaya, Pali should be made like the Shushka Mamsa. That is a dry meat or flesh. It should be splitted in many ways, and then union should be carried out. It is known as Valluraka. Next slide. Asangim. Asangim means the Vasang, that is close adherence in intent attachment. Thus, the Sandhana union of Pali only inner or anterior elongated appendage should be made like Vasang, that is close adherence. It is known as Vasangim. Next slide. Next is Gandakarana. The process known as Gandakarana consists in slicing of patch of healthy flesh from the one of the region of the cheeks and adhering to it to one of the slippery lobes of the ears. This is Pali Lakshana. The Pali having Baya Dirga Pali and Itar Alpa Pali. Next slide. Next is Ahara. Ahara means Ubaya Pali, means in the absence of appendage of lobes. In that case, Ahara Sandhana Karma is done. Ahara means extract or removed. the flesh should be removed from both the cheeks and added to them in a manner so as to one of its ends attached to its former sheets. Next slide. Next is Nirvedim. Nirvedim means decided from the piercing part. Injured part should be pulled down and adhesion is done. Next slide. Vyayojam. The process known as Vyayojam that is a planning the union in various ways. Is not a Vyayojam. Next slide. Kapata Sandhika. Kapata Sandhika means Kapata means door. The process of known as Kapata Sandhika consisting bringing about an addition like door that is Kapata between one of the bifurcated lobes and another. Next slide. Ardha Kapata. The process is known as Ardha Kapata. So it consists of bringing about an addition of outer elongated lobe to inner shorter lobe. Next slide. After Sandarkam, and next we have to do the Bandhana Vidhi, that is bandages. These are the 7 types of bandage which is mentioned in the Ayurveda classical. There is a Abhyanja, Aguntana, and Bandhana, Avikirana, Ranayukta, Vidana, Parisejana, and Pichu Parivartana, Pariyara Vishaya, and Karnapali Abhivardhana. Next slide. Next is Nasasandhana. These are the picture which is showing 6 steps which is mentioned in Nasasandhana. Next slide. Patragana, first leaf of creepers along broad or enough fully to cover the whole of the cut of the part of nose should be gathered. And next is Ganda Pashva Utkata, that is a patch of living flesh equal in dimension to the preceding leaf should be sliced off from the region of the cheek, maintaining its continuity. Next slide. Nasa Bandhana. After scarifying the Nasikagra, the patch should be added to the injured nose. Then the patient should tie it up by the proper technique of bandhana, that is suturing. Next slide. Nadi Yoga. Inserting 2 small pipes into the nostril to facilitate respiration and to protect additional flesh from the hanging down. Next slide. Avachurana. It should be dusted with the powder of following Aushadh, that is Patanga, Estimadukam, and Sanjana. Next. Taila Sinjana. The nose should be covered in the Karpasa cotton and several times sprinkled over with the Tilatela. Next slide. Next, we are to do Signa Virechana. That is, the Gruta should be given to the patient for drink, and he should be anointed with the oil and treated with purgatives. Next is Ardha Shesha Nikuta. In this case of semi or partial adhesion, the nose should be again scarified and bandaged. Next slide. Vardhana and Samam Karma. That is, the adhesioned nose should be tried to be elongated to prevent fall short of its natural shape and previous length. Next slide. These are the steps which is followed in the Aushadh. Next slide. Nadi Yoga Vinasasya Nasandana Dvidam. Nadi Yoga, the Achar Shushta and Vagbata both as mentioned the method of Aushadh similar to the Nasasandana, exception of the insertion of the pipes or tubes. One who knows all this procedure, that Nasasana, Karnasana, Aushadhana, that person fit to treat a royal surgeon. Next slide. Conclusion of the topic is Karnasa Aushadhana, Karma is high standards of surgery skills of ancient Indian surgeons. The detailed description of Sandhana Karma by Shushta is amazingly comprehensive and relevant to today's plastic and reconstructive surgery. More appreciable results may be expected in today's reconstructive surgery by the adopting the Sandhana Karma in indication, contraindication, and techniques mentioned by Sushruta. Sushruta emphasizes all the basic principles of reconstructive surgery and its important contribution like techniques of pedicle flap, repair of earlobes defects, traumatic and congenital defect of the lips, etc. still remains as a conservativity in the field of reconstructive surgery. Next slide. Thank you, Orion.
Thank you, Doctor.
Okay, sir.
Next, I invite Dr. Pradipha R for the paper presentation on the topic Alzheimer's disease and Ayurveda. Dr. Pratibha, please unmute, doctor.
Yes, sir. Can you hear me?
Yes, doctor. Please share the screen, doctor.
Okay.
Your screen is visible, Dr. Pratibha. Please start the session.
Good evening, everyone. Myself, Dr. Pratibha, third year PG scholar. I'm from KC department, RAMC. And today I'm dealing with Alzheimer's disease and its correlation with Ayurveda. Introduction. Alzheimer's disease is a neurodegenerative disorder marked by cognitive and behavior impairment that significantly interferes with social and occupational functioning. It is a progressive and the most common forms of dementia among elderly. The prevalence rate per 1,000 persons above the age of 55 years is 11.67, and for those above the age of 65 years is 15.54. Alzheimer's basic pathology. The brain in Alzheimer's is macroscopically atrophic cerebral cortex. Histologically contains senile plaques and neurofibrillary tangles in the cerebral cortex. Hippocampus atrophy. Histochemical staining demonstrates more of amyloid plaques. The disability in performing daily activities and decline in cognition, intellect, and memory is due to the deposition of undigested amyloid and proteins deep inside the hippocampus area, obstructing the neurochemical transmission. These are the plaques and tangles and hippocampal atrophy. Clinical stages are preclinical, mild to moderate, and severe ill. Preclinical Alzheimer's. The pathologic changes associated with AD begin in the entorhinal cortex, which is near the hippocampus and directly connected to it. AD then proceeds to the hippocampus, which is the structure that is essential to the formation of short-term and long-term memories. Affected regions begin to atrophy. These brain changes occur decade before any signs or symptoms appear. This stage is usually asymptomatic and is accidentally diagnosed based on the atrophic changes of the brain. These are the preclinical Alzheimer's. Mild stage. As AD begins to affect the cerebral cortex, memory loss continues and impairment of other cognitive abilities emerge. This stage is referred to as mild AD. The clinical diagnosis of AD is usually made during this stage. Signs and symptoms include memory loss, confusion about the location of familiar places, taking longer to accomplish normal daily tasks, trouble handling money and paying bills, compromised judgment often leading to bad decisions, loss of spontaneity and sense of initiative, mood and personality changes, increased anxiety will be there. In mild stages, there will be a moderately enlarged ventricles we can see, and cortical shrinkage will be there, and shrinkage of hippocampus. In moderate stage, by the time of AD reaches the moderate stage, damage has spread further to the areas of the cerebral cortex that control language, reasoning, sensory processing, and conscious thought. The change in behavior, emotions, judgment are literally affected the moderate stage. Behavior is a result of compromised brain process, all of which takes place fraction of a second in the initial brain. In AD, many of these processes are disturbed, and this is the basis of many distressing or inappropriate behaviors. The anger is a mask for underlying confusion and anxiety. For a person who cannot remember the past or anticipate the future, the world around them can be a strange and frightening. Judgment and impulse control continue to decline at this stage. In severe stage, in the last stage, severe AD plaques and tangles are widespread throughout the brain, and areas of the brain have atrophied further. Patients cannot recognize family and loved ones or communicate in any way. They are completely dependent on others for care. All sense of self seems to vanish. Other symptoms may include weight loss, seizures, skin infections, difficulty in swallowing, groaning, moaning, or grunting, increased sleeping, lack of bladder, and bowel control. In end stage of AD, patients may be in bed much, and death is often the result of other illness, frequently or aspiration in pneumonia. In severe stage, there will be severely enlarged ventricles can be seen, and extreme shrinkage of the cerebral cortex and extreme shrinkage of the hippocampus. Diagnosis includes the clinical diagnosis of AD is usually made during the mild stage of the disease using the signs also. And imaging studies are particularly important for ruling out potentially treatable causes of progressive cognitive decline, such as chronic subdural hematoma or normal pressure hydrocephalus. Moreover, volumetric studies of the hippocampus and FDG, PET with or without amyloid imaging have been employed for early detection and differentiating dementia etiologies. Management includes, to date, only symptomatic therapies for Alzheimer's disease are available and thus do not act on the evolution of the disease. The standard medical treatment for AD includes cholinesterase inhibitors and a partial N-methyl-D-aspartate antagonist. Mild to moderate can be treated with cholinesterase inhibitors, and mental exercise are used in the attempt to prevent or delay the deterioration of cognition in patients with AD. Donepezil, rivastigmine, etc. drugs can be used. Many experts believe that mentally challenging activities such as doing crossword puzzles and brain teasers may reduce the risk in such patients. On moderate to severe Alzheimer's management, the partial N-methyl-D-aspartate antagonist memantine is believed to work by improving the signal-to-noise ratio of glutamatergic transmission at the NMDA receptor. Secondary symptoms management. The following classes of psychotropic medications have been used to treat the secondary symptoms of AD, such as depression, agitation, aggression, hallucination, delusion, and sleep disorder. Antidepressants, anti-Parkinson's agents can be used. Beta blockers, anti-epileptic drugs, neuroleptics, and amyloid-directed antibodies can be used. The side effects may include like nausea, vomiting, diarrhea, and dizziness, confusion, headache, constipation, cough, etc. can be seen. And AD as correlated with Ayurveda, we have many instances mentioning about higher mental functions in Ayurveda. Alzheimer's being a neurocognitive impairments presents as a mixture of lakshanas mentioned under Unmada, Apasmara, and Tattva Vinivesha, etc. If possible, an attempt can be made to correlate AD with an exact clinical condition mentioned in our text. If not possible, the pathogenesis has to be visualized throughout our basic concepts like Agni, Ama, Srotas, Sroto Dushti, Avarna, Dhatukshaya, Jara, Shosha, Kleda, Vishandi, etc. Smriti Bramsha, Mano Buddhi Vibhrama, Cheshta Achara, Sheela Vibhrama are the most probable clinical correlation in parallel to symptoms of AD. These are all the disease of the mind developed due to Prabhaktivata. Hina Sattva and Rajas predominant person with stressful lifestyle are more prone to develop these symptoms. Upanishad says, Yat Anishtaha Tat Manaha. The subtle part of the food consumed contributes to manas. The food and higher mental functions are correlated each other. Ayurvedic view, the pranavayu commands the buddhi, hridaya, indriya, chitta. That is buddhi, hridaya, indriya, chitta, the normal functions of pranavata. Pranavata comes under balavarna smriti kriyaha. A sadhaka pitta helps in buddhi medhavi manadhyayi. Tarpaka kapha, shirastu aksha tarpana tarpakaha. The vijayation of the respected dosha result in a raja and tamo dosha prakopa, which result in disturbance of the dhriti buddhi smriti sanya. These are the basic points we get regarding higher mental functions and their impairment. AD pathology and Ayurveda. In Alzheimer's, the basic pathology remains the undigested protein molecules which inhibit the neurochemical transmission. Brain atrophy is Dhatukshaya as Majjakshaya. Any undigested molecules to be visualized at Vata Kaphaja Ama. If the molecule has got bleeding tendency or inflammation tendencies, then Pitta Anubandha can be considered. So it's basically Avarna pathology. Hence, in Alzheimer's, atrophy due to protein deposition can be understood as Dhatukshaya due to Markavarna. This is amyloid plaques and tangles deposition can be correlated with Vata Kaphaja Ama Avarna. Atrophy can be taken as Majja Dhatukshaya. The treatment plans. Treatment should address the basic pathology. It should aim at dissolving the undigested protein molecules deep inside the hippocampal area. Prior Shodhana if patient is Balavan. The drug is chosen in such a way that it should act on Avarana and Dhatukshaya at the same time. Drugs mentioned as Medhya is beneficial. Treatment according to Rogi Bala. If patient is Balavan, Alzheimer detected early in a young patient can be fit for Shodhana. Basti is a good choice. Nasya can also be considered. Usually the patient of AD is an age-old subject. Shodhana may not be a good choice. In these cases, a mild Shodhana can be followed by a Medhya Rasayana beneficial. Selection of drugs. Dravya should be a Medhya. It should act on Vata Kafaja Ama, like having Gunarasa like Katutikta Rasa, Ushna Virya, Kledahara and Medhya. It should act on reversing the atrophy or at least to arrest the prognosis. It should be able to cross blood-brain barrier. The drugs acting on gut-brain axis can also be considered. Medhya Rasayanas, Katutikta Ushna, having Medhya, Vacha, Shanka Pushpi, Jyotishmati, Rudraksha, Haritaki. These drugs can be given. The drugs in Ayurveda which cross BBB include Kruta, Asava, Arishta, and Basma. The use of Asava Arishta may increase the atrophy of brain. It's better to use Kruta and Basmas. Kruta processed with the above drugs are beneficial. Swarna Basma, Rajata Basma, Abraka Basma are well-known drugs which work on higher mental issues. Medhya Kruta, some Medhya Krutas, Kalyanaka Kruta and Mahakalyanaka Kruta, Mahapanchagavya Kruta, Chetasa Kruta, Kshira Kalyanaka Kruta, Saraswata Kruta, Haritaki Kruta, Chatush Kovala Kruta. A patient of AD who has been treated for essential hypertension accidentally showed significant changes in behavior and memory. The treatment administered was Kshira Kalyanaka Kruta. Conclusion. Any contemporary disease which cannot be correlated exactly in Ayurveda can be visualized through our basic concepts like Agni, Ama, Srotas, Jara, Shosha, Kleda, Vishyandi, Avarana, Dhatukshaya, etc. so that the treatment can be planned logically. Hence, in Alzheimer's disease, the drug should address Vata Kafaja Ama, Macha Dhatukshaya and all the higher mental functions. The Krutas processed with Katutikta Ushna Dravyas as Shamana Bhumana Sneha. Or the same snehas can be given as Pratimashanasya. In Balavan patient, Shodhana can be administered. Thank you.
Thank you, doctor. Next, I invite Dr. Supriya ji for the presentation.
Hello.
Yes, doctor, you are audible.
Yeah.
Please share the screen.
Yeah. I'm not able to share the screen.
Dr. Supriya?
Yeah, it's coming as error.
Okay, doctor, I will share for you. Just a second, doctor.
Yeah, sure.
Doctor, please start the session, doctor.
Yeah. Namaste. Myself, Dr. Supriya Acharya, second year PG scholar, Department of Chalakitanda, GMC, Bangalore. My topic of today's presentation is conceptual study of amblyopia and Ayurvedic perspective. These are the contents. And going on with the Ayurvedic part. So in Ayurveda, we don't have the proper correlation of amblyopia. So based on the signs and symptoms, pathogenesis of amblyopia, we will treat in Ayurveda. So going on with the introduction of amblyopia, there is no use with the eye, even though when it looks normal, but if it can't function properly. So this occurs because favoring of the brain for the other eye, and this pathological condition is popularly known as the lazy eye or the dull eye, and the medical term is amblyopia. Going on with the definition, a partial reversible loss of vision in one or both the eyes for which no cause can be found by physical examination of the eye. So here it is reversible only if appropriately treated at the proper time. Unilateral or bilateral it is, no cause can be found, that there is absence of any organic disease of ocular media or the retina or the visual pathway. So here some kids are born with this condition and some others will develop it later. And the deficiency here, it is in the image formation in the retina, that is form vision deprivation. The weak eye here often wanders either inwards or outwards, and this weak eye, which is not properly developed, it seems to be lazy in the function compared to the normal eye, and hence the name lazy eye. Next slide, please. Going on with the pathogenesis, onset is usually from birth till 8 to 10 years of age. So if there is earlier onset, there will be greater deficiency. So the pathogenesis involved is a neuronal plasticity. What is neuronal plasticity means? It is creating neuronal pathway every time we see something new. So the presence of some of the amblyogenic factors like visual deprivation, it may be equal or unequal uncorrected refractive errors, light deprivation factors, that is obstacle to the vision, abnormal binocular interactions as in strabismus. These factors will hamper this neuronal plasticity, and thus the eye shall remain weak. So this usually occurs in children, that is from 8 to 10 years of age. Hence screening in school becomes very important. If the child, because the child usually doesn't get to know that the eye is visually impaired or what. So hence screening is very important less than 5 years of age. Next slide, please. These are the three basic types, that is strabismus, refractive, and stimulus deprivation. What is strabismus? That is either it may be isotropic or exotropic, inwards or outward turn, usually unilateral. Visual acuity loss will be moderate to severe here. And going on to the refractive variety, anisometropic, that there will be visual loss in the right and the left eye, that will be different. Isoemetropic, where in both the eyes there will be similar high visual acuity loss. And meridional refractive amblyopia, that is astigmatism, will be involved. Going on the stimulus deprivation, it is very rare. Here retina doesn't get the image formation here, that is it may be because of congenital cataracts or corneal opacities or ptosis, or even when the child has a front haircut. So this stimulus deprivation amblyopia occurs. Other causes are organic causes, like during the pregnancy period, if the mother has is exposed to tobacco or alcohol or ethambutol, such drugs, or even poison, the fetus may develop amblyopia later. Next slide, please. So these are the signs and symptoms of it. So basically it will be strabismus, that is squinting of the eyes. So because of the strabismus, there will be head tilting, and the main feature is crowding phenomenon. That is when we ask the child to read the Snellen's chart, the letters will be easily differentiated, but when in a book given, when the letters are very near, the child will feel difficulty in reading it. Next slide, please. Next is the symptoms. Symptoms is visual acuity loss. As already told, there will be one or both the eyes, for which there will be no alternate explanation. So here grading is done, that is mild, moderate, severe. If it is more than 6/18 in Snellen's chart, it is mild. 6/60 to 6/18, then it is moderate. If it is less by 6/60, it is considered to be severe. Other than that, there will be squeezing of the eyes, which will be complained by the child or the parent, and the child complains of diplopia, and even one should mainly look out for the presence of amblyogenic factors, which we have already discussed before. Next slide, please. Going on with the diagnosis, so amblyopia is mainly a diagnosis of exclusion. That is, we diagnose the other conditions, and when we exclude them, finally we diagnose amblyopia. Here, what are the things to be considered? First, we need to confirm that is a blur visual acuity loss, that is diminution of vision either unilateral or bilateral with no alternate explanation. Next is crowding phenomenon, fixation reflex, and color vision. Here, fixation reflex should be checked. If there is alternate fixation, then it rules out amblyopia. And other than that, RAPD and nystagmus should never be missed while excluding amblyopia or other diseases and diagnosing amblyopia. Screening, as I already discussed, becomes very important in school-going children, and complication which we can see is, if not properly treated at proper age, then it can result in irreversible permanent loss of vision. Next slide, please. What is the treatment for amblyopia? Gold standard treatment is occlusion, that is patching of the eyes. So here the child is asked to patch the eyes. It may be either a complete patching or partial patching. Partial patching usually we see advise it for 2 hours. So when the child sees any video games or plays any video game, sees TV or does a homework reading thing, so at such times patching is told. So here when to do patching or how much patching should be done. Age should be equal to the number of days patch. If it is a 3 years child, then 3 days should be patched and 1 day off or reverse patching should be done. Next is during the follow-up of patching, what is the thumb? Here we have a thumb rule, that is as per the age, that much week should be followed for that much month. That is, if it is a 3 years age child, then for 3 months follow-up should be done every 3 weeks until 6 months, and thereafter every 2 to 3 months follow-up should be done. When should this patching should be stopped? It should be stopped when both the eyes will become equal visual acuity, and it is maintained like that for 2 to 3 months. And what is the maintenance after this treatment is mainly we go with partial occlusion or with the transparent objects, or we even go with part-time occlusions. Next slide, please. What is the research which is being conducted here? Mainly, since they don't have a proper complete treatment, they go with the research in respect to the treatment. Binox and Orthoptex, these are the softwares which are developed for treatment, that is interactive game sessions. So this is regarding the modern part. Next slide. Going on with the Ayurvedic part, so considering these signs and symptom pathogenesis structures involved, we can correlate with the Prathama and Dvitiya Patlagata Timira. So here Vata dosha, which plays a main important role in the development of the dhatus, we consider it to be a Vata Pradhana Tridoshaja Vyadhi. Next slide. Next slide. Yeah, in Timira, we have treatments like Tarpana, Nasya, Anjana. So, and such therapies are mentioned. And considering the age and other such factors, we consider here Tarpana along with eye exercise and that occlusion therapy. These will play a very vital role in reversing the symptoms of amblyopia. Next slide. Next slide. Going on with the discussion part, so here we'll discuss how Tarpana will act. So based on the drug selected, that is Vata Pradhana Tridosha Shamaka drug, so it helps in the penetration. Next slide. The lipophilic action of the Grita will help in facilitation of transportation of the drug into the target organ, reaching the cell. The corneal epithelium is it allows the lipid soluble substances, and hence the drug shall reach the target organ. Next slide. So going on with the conclusion. Next slide. In Ayurveda, the lazy eye is very much well treated than compared to the modern part. So Tarpana along with eye exercises will help in accommodation, as well as the occlusion therapies, which will help in the initiation of the weak eye. We have a very good treatment in Ayurveda. And for the globalization purpose, we even have to come up with research articles which will help in globalizing the treatment of amblyopia in Ayurveda. Thank you. These are the references.
Thank you, doctor. Next, I invite Dr. Deepshika Sitaram for the presentation.
Yes, ma'am. Am I audible?
Yes, doctor.
1 minute, ma'am.
Hello, Dr. Deepshika.
Yes, sir. Sir, I am unable to share my screen. Will you please share my PPT?
Sure, doctor, I will share for you. Please start the session, doctor.
Okay, sir. Thank you. Hello, good evening, everyone. I am Dr. Deepshika Rakunde, Assistant Professor from Shri Arvind Mahavidyalaya, Dravyagun Department. My topic is impurities of drugs and their purification according to Ayurveda. Next slide, please. Nowadays, there are uses of Ayurvedic drugs for immunity boosting, prevention of diseases, and also for treatment of diseases are increased. Due to increase in industrialization, the land for plantation of drugs are going to extinct. Due to lack of plantation, the drugs are available in lesser form. Next slide, please. Demand of drugs are increased and availability of drugs are decreased, and due to this, the adulteration and substitution of drugs are increased. Due to this, shodhana of drugs are important. Next slide, please. In Ayurveda, the types of impurities of drugs and various processes of purification are mentioned. Common methods of purification and individually drugs purification are also mentioned in detail. Next, please. There are three types of impurities. Bhautik, that is physical. In Ayurveda, it's called mal dosh. Next one, rasayanik, that is chemical. In Ayurveda, it's called vani dosh. And next is sahaj, that is natural. It's called vish dosh in Ayurveda. Next, please. Importance of Shodhan in Ayurveda, that is dosho ka nirakaran, sahaj guno ka utkarsha and gunantar ka adhan. Next, please. General methods of purification. There are 13 methods of purification are mentioned in Ayurveda. So the first one is prakshalan, that is washing. Jal द्वारा prakshalan. Next one chalan, that is sifting. चलनी के द्वारा शोधन किया जाता है. विलयन, that is illustration. चूर्ण करके जल में घोलकर उसका शोधन किया जाता है. Next one sharan, that is lixiviation. विलय द्रव्य को अविलय द्रव्य से पृथक करके शोधन करना किया जाता है. Next one परिस्रवण, दैट इज परकोलेशन. फिल्ट्रेशन के द्वारा किया जाता है. सुरा विलयन, दैट इज मैसरेशन. सुरा में विलय, जो सुरा में द्रव्य सुरा में विलय उनके द्वारा उसका शोधन किया जाता है. नेक्स्ट वन पृथक्करण, दैट इज डायलिसिस. क्रिस्टलाइन एंड क्लोराइड्स, दैट आर टू ड्रग्स व्हिच आर सेपरेटेड फ्रॉम ईच अदर बाय शोधन. निर्मलीकरण, दैट इज डिस्फ्यूमेशन. सेंद्रीय द्रव्य को उबाल के उसका शोधन किया जाता है. नेक्स्ट प्लीज. विवर्णीकरण, दैट इज डिकलरेशन. सत्व निकालते समय जो किया जाता है उसको शोधन कहते हैं. नेक्स्ट वन स्वेदन, बॉइलिंग, दैट इज स्वेदन के द्वारा किया जाता है. मर्दन, दैट इज रबिंग. मर्दन द्वारा, खरल में मर्दन द्वारा उसका शोधन किया जाता है. निर्वापन, दैट इज डिपिंग. आग, द्रव्य को आग में गर्म करके दूसरे द्रव पदार्थ में डुबोकर उसको शोधन किया जाता है. नेक्स्ट वन पातन, दैट इज सब्लिमेशन. यूज फॉर उड़नशील द्रव्य, जो सुगंधित द्रव्य रहते हैं उनके द्वारा इसका शोधन किया जाता है. नेक्स्ट प्लीज. विशिष्ट द्रव्य का शोधन. गुग्गुल, दैट इज एक प्रवर्तक. चौगुने गोदुग्ध में शोधन के द्वारा गुग्गुल को शोधित हो जाता है. वसनाभ, चने के बराबर के टुकड़े गोमूत्र में भरकर डुबो के रख देना चाहिए 7 दिन में. प्रतिदिन उसका गोमूत्र बदल के उसके बाद उसकी त्वचा 7 दिन के बाद त्वचा को अलग करके धूप में सुखाने से वसनाभ शोधित होता है. पुपिलु, बीजों को पोटली में रखकर गोदुग्ध में एक प्रवर्तक स्वेदन करके जाता है. उसके बाद छिलका हटाकर घृत में भून लेने से, चूर्ण करके रख लेने से पुपिलु शोधन हो जाता है. नेक्स्ट प्लीज. आइफेन, आर्द्रक्स के 21 रस की भावना से उसका शोधन होता है. जयपाल, बीजों को दोनों दलों के बीच में से हटाकर हरितत्व शुद्ध, जो हरित वर्ण का जो सदृश भाग होता है उसको गोदुग्ध में एक प्रवर्तक स्वेदन करने से जयपाल का शोधन होता है. धतूर, बीज को एक प्रवर्तक गोदुग्ध में स्वेदन करने से स्वेदन करके उसके बाद गर्म जल से धोने से धतूर का शोधन होता है. विजया, पत्रों के जल से खूब धोकर गोघृत में हल्की आंच पर भून लेने से विजया शुद्ध होता है. नेक्स्ट प्लीज. गुंजा, बीज के चूर्ण को 1-2 प्रवर्तक गोदुग्ध या कांजी में स्वेदन करने से शोधन शुद्ध होता है. भल्ला तक, फलकों के वृंत भाग को काटकर उसके चूर्ण में गाड़कर 7 दिनों तक रखने से उसके बाद गर्म पानी से धो ले, उससे भल्ला तक शुद्ध होता है. उससे उसका उष्ण और तीक्ष्ण गुण कम होता है. स्नुई क्षीर, 20 ml इमली पत्र स्वरस में मिलाकर धूप में रख देने से स्नुई क्षीर शुद्ध होता है. रक्त चित्रक, मूलों को चूर्णोदक में डुबोकर धूप में सुखा लेने से शुद्ध होता है. नेक्स्ट प्लीज. हिंगू, हिंगू के संभागृत में भून लेने से हिंगू शुद्ध होता है. हिंगुल, चूर्णांक में नींबू के रसा के साथ भावना देने से शुद्ध होता है. शंखवी शोधन, कपिल के रस में 2 प्रहर तक स्वेदन करने से शुद्ध होता है। धातुओं का सामान्य शोधन दिया है। तिल तेल, तक्र, गोमूत्र, कुलत्थ कषाय, कांजी में 3 बार भंजने से उसका शोधन होता है। रत्नों का सामान्य शोधन दिया है, जो जयंती पत्र स्वरस में 1 प्रहर तक स्वेदन करने से रत्नों का सामान्य शोधन हो जाता है। नेक्स्ट प्लीज। Importance of Shodhan. Due to increased demand of drug and expensivity of the same, the adulteration of the other drugs mixed with the drugs which looks like the same is also increased. Due to transportation, there are chances to mix one drug with another. Next, please. Naturally, there are mixture of sand, soil, leaf of other drugs are also present. In industry, some people are intentionally added to drugs which are look like same for cost cutting. Due to the above reason, the potency of the drugs are decreased. Next, please. Thank you.
Thank you, Doctor. It was a well explained presentation.
Next, I invite Dr. Devyani Dasa for the paper presentation.
Am I audible, sir?
Yes, Doctor. Audible, Doctor.
Okay. May I share the screen?
Sure, Doctor. Please share the screen. Your screen is visible, Doctor. Please
Okay.
start the session.
Okay, sir. Is it okay, sir? Is slides are moving?
Slides are moving, Doctor.
Yeah, thank you so much. Myself, Dr. Devyani Dasar, Associate Professor from Department of Shalya Tantra of Mahatma Gandhi Ayurved Medical College Hospital and Research Center, Wardha, constitute unit of the Tamegi Institute of Medical Sciences, Wardha. My title of presentation is Role of Jalokarjana Therapy in Jano Sandhigat Vata with special reference to osteoarthritis, a clinical study. So clinical study prospects are including introduction, aim, objectives, methodology, follow-up with discussion and conclusion. So about the Sandhigat Vata, Shula Pradhana Vetana with Vatapana Dhrutisparsha according to the Sushru Sutra Sthana. And also it occurs after the age of 35 years, and we can correlate with the osteoarthritis, which is the most common form of the joint disorder. So treatment regarding these are the in modern sciences there are injections and some steroids, high table osteotomy with a joint replacement surgeries. And our Acharya Sushruta told about the Sneha, Upanaha, Agni Karma, Bandhana, Mardana, Snayu Asti Sandhi Samprapte Kuryat. So Charak Chikitsa, Charak Sutrasthana, Sushru Chikitsa, and Bhav Prakash Dhanvantari Nighantu. These are the references of the treatment for the Sandhigat Vata. So aim is the assessment of an effect of this Jalauka or Charna, that is the leech therapy in Janu Sandhigat Vata, with the objective to study the effect of Jalauka or Charna in Janu Sandhigat Vata. Age summary is the male and female patients of 40 to 60 years of age suffering from Janu Sandhigat Vata, having pain in knee joint, swelling on the joint, and difficulty in movement. There are no any diabetes mellitus, other systematic diseases, and also there is no any long use of any medications. So these are the materials. Jalokarjana done on the affected joint weekly once for the 6 weeks, and the materials required for this one, of course, Jaloka, turmeric, 3 kidney press, Raktastambhak yoga, and the other accessories. Also follow-up of 2 weeks. Now observation. So here is the Jalokarjana found the most efficacious parasurgical procedure in this trial. And according to these results, age and gender incidence. So here is the age of in range, male and female patients. So totally 20 patients, and the percentage of the age as per shown in the table number 1. As per in the table number 2, I found a good result in a male patient of 9 and fair and poor 2 and 3 male patients. With the female patients, a good result is 3. Fair and poor 2 and 1. So like this, totally 20 patients I got. A highly significant result found in reduction of pain, with the significant result in reduction of swelling, tenderness. Marked improvements seen in 6 patients. Moderate is seen in 4 patients, remaining improving.
Actually, the study is still going on. Just only the 20 patients case summary I just gave here. The discussion is found effective treatment for a rapid reduction of pain and reduce the symptoms of the osteoarthritis, very significant in improvement of functional recovery, and has a potential of being additional alternative treatment for osteoarthritis, where there is one of the only modality of the surgical replacement. So conclusion, it is found effective in Janusandhigat Vata, may inhibit high tibial osteotomy and further surgical corrections in old age patients. Easy to do and cost effective than surgical corrections. Here, in terms of references, I want to tell about the thing that the patients are still going on, and after 6 weeks of Jalokaucharna, there is no pain found up to the years of the 5 years of their follow, because I am just connected with all the patients and I found very good results in this one. So these are the references. Thank you, IRAPT organization, for giving this chance to me for the presentation. Thank you so much.
Thank you, Doctor.
Thank you, Doctor.
It was a wonderful presentation.
Thank you, Doctor. Next, I invite Dr. Jayant Anandrau for the paper presentation on the topic Importance of Nidana Panchaka. Dr. Jayant, are you there?
Yes, sir.
Okay, Doctor, please share the screen, Doctor.
Yes. Can you share?
Okay, Doctor, I will share for you. Just a second, Doctor. Please start the session, Doctor.
Yes, good evening. Myself, Dr. Jayant Mare, Assistant Professor of Chikitsa Department, LRP College, Islampur. Next, today's my presentation topic is the importance of the Nidan Panchaka. Okay, so the importance of Nidan Panchaka is very important, the diagnostics tool for the diagnostic of the diseases. So without diagnosis, we can't do the treatment. So like this, the physician should first diagnose the disease, select the proper medicine, and the physician who is initiate the treatment without proper diagnosis. So for that, for the diagnostic purpose, and you have to compile all the symptoms, and you have to use this Nidan Panchak and then diagnose and then the treatment. So for the diagnostics, the important of the Nidan Panchak is important. Okay, the next slide. The importance of the pariksha prior to the chikitsa, like that. So chikitsa ke before आपको diagnosis करना है तो परीक्षण important है. So physicians should first all the diagnose the disease or the select the proper medicine. Then after that you should administer the therapy applying the knowledge of the science of the medicines. So always proceed with the treatment after proper the examinations. So examination is very important. You have to compile the history and you have to find out all the Nidan Panchaka, compile it and then diagnose it. Okay, so the importance of the pariksha prior to chikitsa. Next. So the role of Nidan Panchak is very important. This is the Swastha Swastha Rakshana Vikar Prashnavanshi. This is very important. The word Nidan here denotes the diagnostic example, examinations, and the Panchak denotes the number of 5. The 5 methods which are used to gain the complete and detailed knowledge of the disease and then confirm the diagnosis. And that is called as the Nidan Panchak. Before treatment, you have to use it and diagnose it. Okay, next. See, these are the Nidan Panchak, Nidana, Pururupa, Rupa, Sampraptin, Upashaya. Next. So the importance of the Nidan Panchak, again, the current healthcare system focuses the finding out the pathogenic, the microorganisms, the causes, the diseases. The Ayurveda on the contrast emphasizes the defect, the biological system that occur due to the various reasons, include the improper diet and lifestyle. That is The knowledge of etiology, causative factor for the health and disease is an important component of the three fundamental. It is the three sutra of the knowledge of the Ayurveda. Next, the Nidan. The Nidan has two different concepts. That's the diagnosis of the disease, Nidana, and the etiology factor of the disease. So two contests, and the synonyms, the Nimitta, Hetu, Ayata, Pratyata, Uttana, Karana, and Samuthana. Okay, next. The factor which has the ability to perform the function, which will undoubtedly use the rise the diseases. So these are the factors we can consider as a positive factors. The dosha, dushya, samuchana, samprapti, etc. is called as the nidana. For example, the wrongful lifestyle practices have the ability to vitiate the doshas, and which then use the various pathologies that give the rise to diseases. So we can here consider as the positive factors. Okay, next. The importance of Nidan, why Nidan is important in the diagnosis of the disease. The diseases can be cured by the simply removing the cause. So you have to treat the cause, find out the cause, remove the cause, you can treat the disease. For that purpose, the importance of Nidan is here. If the Vaidya can identify the Nidan of the disease, it can be surely treated by the removal of the same to prevent further pathogens and the complications. So Nidan is very important to find out the cause of the diseases. For identify the cause, Nidan gives the clue towards that chronicity of the diseases, like the liver cirrhosis has the history consumption of the alcohol, like that. If alcohol is a cause, you have to remove it, or you have to find out the cause and you have to stop it taking the alcohol. You have to treat the further complications by the liver disease, like this. So important of the Nidan is very important because you have to remove the cause before treating the disease. Next. Next is Nidan Panchik is the Purva Rupa. So Purva Rupa is before the Rupa, before the actual symptom of the disease. What are the symptoms before the Rupa? That is the Purva Rupa is likely the approach the disease where we can't specify the pathogenic agent like the dosha, dusha, etc. due to the mild nature and incomplete the manifestation of the disease. The Acharya Charan defines the Purva Rupa as a symptom that are some before and the actual symptom of the disease. In the pathological process, the doshas get vitiated and get lodged at the particular space, that is the sthana sanshraya, and then the process started. It is before the few symptoms generated is called as a Purva. The Purva gives us the initiation of the upcoming of the diseases. So it's very important to find out the Purva. Next. The importance of Purva is the confirmation of the disease to find out the Purva, the Prameya, and like for example, the Prameya and the Rakta Pitta. And next is the for prognosis of the diseases that determine the sadhya of the diseases. That's all the Purva Rupas are like the Jora are considered as asadhya. For diagnosis of the disease is very important. For differential diagnosis of the disease is also important, and for treatment of the diseases. So the Purva Rupa is before the Rupa. It's very important in the clinical practice. Next. So next actual symptom of the disease that the Rupa, you have to how to find out the Rupa and then diagnose the disease. The sinus symptoms which are the represent the occurrence existence of the disease called the Rupa. Okay, so the unexpressed prodromal signs and symptom of the exhibit themselves with the disease prognosis is the Rupa. Signs symptoms of fully developed disease is called as Rupa. Next. Here the symptoms are fully developed. Next. These are the again importance for the diagnosis of the disease, that the link that the Rupa represents the stage of the disease where Vyaktavastha. Okay, this is Vyaktavastha, where this the treatment disease. Okay, and Chikitsa is applied directly. We can treat at this stage. We have to diagnose the disease and start the treatment. So practitioner key in the following such a treatment should be the well versed in the clinical features of the management. The appearance of the sign and symptom that the Linga Rupa represents of the fifth stage of the disease prognosis. It's very appropriate to the events break the prognosis of the disease. We can break the prognosis. We have to always start the as early treatment, and you have to prevent the complications. So the sign indicates the abnormality, morbid the phenomenon, and departure from the physician's normal structure, function, and sensation experienced, observed, and the interpreted. So Rupa, here we diagnose the disease and you have to prevent the further complications. Next. Samprapti is again the pathogenesis. So here, what is the mechanism? And this is after that produced, that is the Samprapti. The mechanism starting from the visheshan of the doshas till the origin of the complete the manifestations, development of the disease. This is a Samprapti. Next, the knowledge of the Samprapti is very important in the diagnosis of the disease. So next slide. These are the classification of the Sampraptis. These are the classifications given in the textbook for the details of the disease knowledge. Next. The clinical importance of the Sampraptis is because the diagnosis of the disease, subtle knowledge of the disease for the Chikitsa purpose, and identify the Sthana Samshara to rule out the Sthanavastha of the diseases. Okay, Sadhya of the disease, it helps to know the actual pathogenesis of the disease occurred in and the complications. That is the Samprapti Ghataka. It helps to know the stage of the pathogenesis and formation of the disease and further complications of it. The knowledge of the Samprapti is helpful to cure the disease by achieving the Samprapti Bhanga. So the knowledge of Samprapti is very important to rule out to find out for the Samprapti Bhang and Sthana Sadhya of this time is Sthana Sanshara Avastha. So this is important. Next. So here we explain the Upsha and Anupsha, where the diagnosis is foggy, the physician gets the trap while making the diagnosis, then the principle of the Upsha should be applied. So the Upsha in the treatment and the diagnosis of the disease is important. So Upsha. Next. Upsha, when the therapeutic test result is the lowering the symptoms, where we are using or giving the patient to the some treatment and patients get the relief of the symptom, that is called the Upsha. For example, that is due to the hot fermentation, the joint pain relieves, that the pain is Upsha. Anupsha, where this treatment results, the increase the symptoms, aggravate the symptoms. For example, the oil massage in the treatment given, the increases the pain in Anupsha. Okay, Snehana. So these are the Upsha, Anupsha. Here is again important tool for the diagnosis of the disease. Next. So Upsha which gives the pleasure to the patient, and Anupsha which gives the feeling the happiness. Upsha gives the happiness to the patient. Patient feels better after giving the treatment, after giving the Ahara, Vihara, like that. After giving the fever, after giving the Aushadh, patient gives the happiness, relieves the symptoms, Upsha. And it's in case of the difficult to diagnosis due to some of hidden things, mimicry nature of the disease, in such circumstances, Upsha and Upsha therapy should be. It's a diagnostic points. Okay, it helps in diagnosis. So here, knowledge of the Upsha is very important. Okay, next. Fourth classification, these are the classifications. Upsha, the Hetu Viparit, Vyadhi Viparit, the Hetu Vyadhi Viparit, related to the Aushadh and Vihara. So Hetu Vyadhi Viparit, Vyadhi Viparit Hitakari, and Vyadhi Hetu Vyadhi Vipratkari. So these are the types just for the related to the Aushadh and Vihara, like that. Next. So knowledge of this Upsha is very important according with this classification. The importance of Upsha and Anupsha, the therapeutic testing plays a very important role in the determine the dosha in doubtful cases where signs and symptoms don't through the is confirmed diagnosis. So the Upsha and Anupsha helps the formulate the Patyapata regimen of the treatment, and according to the therapeutic tests are the often used in the difference between the disease and similar symptoms. For example, the Sandigat Vat and Amvat. If you are confused, you are in this condition, you have to use the Upsha and Anupsha. Next. Diagnostic importance of the Upsha. When there is in the confusion, you find like this. When you are the confusion in this diagnosis, so you have to use this Upsha and Anupsha. These are the given some examples. Next. Along with that, Nidana Panchaka Upsha Anupsha is very important. Upadrav. Next. What is of complications where Upadrav is a complication, is a major and a minor disorder itself, manifesting in the latter stage of the disease and rooted in the main stage. Hence, the main disease is primary and complication is a secondary. So you have to know knowledge about the Upadrava. Okay, so primary disease and secondary complications. So knowledge of Upadrava is important to for the prognosis of this. Next. Thank you. Upsha, the Panchanidana along with Upsha, Anupsha and Upadrava. These are the important factors for the diagnosis. Thank you.
Thank you, doctor, for this well and detailed explanation of the topic.
Thank you, doctor. Next, I invite Dr. Shruti for the paper presentation. Dr. Shruti, are you there?
Yes, yeah, sir. Yes. Hello, sir. Am I audible?
Yes, Dr. Audible. Please share the screen, Doctor.
Yeah, sir. Wait a second. It's like unsupported documents, sir. It's not sharing. Excuse me, sir.
Don't worry, Doctor. I'll share for you. Just a second, Doctor.
Hello. Excuse me, sir.
Just a moment, Doctor. I'll share for you.
Ha, sir.
Doctor, please start the session, Doctor.
Yes. Good evening to one and all. This is Dr. Shruti. My topic is an Ayurvedic approach to tooth extraction with the Jalandhara Bandha Yoga. Next slide, please, sir. Content of my topic presentation is Introduction, Jalandhara Bandha Yoga, Dantaharana Karma and its indications, steps of tooth extractions, a probable mode of action of a tooth extraction with Jalandhara Bandha and its advantages, disadvantages, benefits and conclusions. Introduction to the Jalandhara Bandha Yoga is Yoga and Ayurveda is a ancient science of Indian wisdom. We get many references regarding a surgeries being carried out by Acharya Sushrutas or our ancients. Hence, Sushruta is called as father of surgeries. One such an example is a painless tooth extraction by Jalandhara Bandha Yoga. Next slide, sir. Now I'll explain what is Jalandhara Bandha Yoga. Jalandhara Bandha Yoga, it involves a contraction of a throat and pressing a chin firmly against the chest. Its benefits of this technique is it stops opening of groups of nadis. Next slide. Next slide, please. Jalandhara Bandha will get references from different yoga samhitas like Hatha Yoga Pradipika and Geranda Samhita. I have taken a reference from Hatha Yoga Pradipika. Shloka goes like this: Kantam akucharudde stape chibukam dudam bhando jhaladharakyam jaramruti vinashakam. This explains: inhale deeply and hold a breath. Place the hands on the knees. Lift the shoulders and tilt the body forward and slightly. Keep the back straight. Benefits of practicing this yoga or Jalandhara Bandha Yoga awakens the inner energy, especially a Vishuddha Chakra. Vishuddha Chakra will get active after performing these procedures. That is Jalandhara Bandha Yoga. Next slide. A literal meaning of Jalandhara means log. Networks or devices is Jalandhara. Am I audible?
Yes, Dr. Audible. Please continue, Doctor.
Yeah. With the continuing of the literal meaning of Jalandhara Bandha or a blocking of a nerve plexus, arteries, veins of the necks. This technique of blocking a nerve plexus made use for the extraction of tooth without anesthesia. Jalandhara Bandha indication of perfect contraction of the throat. Next slide, please. Dental extraction can be correlated with the Dantaharana karma, which is one among the 8 Shastra karmas explained by Acharya Sushruta. Dantaharana karma, that is exodoncia, is nothing but removal of a tooth from its socket. It is a minor surgical procedure. It is most common procedure performed in oral surgeries. Next slide. For the procedure of Dantaharana karma and post-op managements, that is Paschat karma, we'll get reference from Ashtanga Hridaya Uttara Tantra. Next slide, please. Acharya Sushruta and Acharya Vagbhata, both of them, they have mentioned regarding the extraction of a tooth in their Samhitas. Even after a lot of conservative measures, that is an indication of tooth extraction. Even after a lot of conservative measures like Svedana, Vistavana, Snigdha Lepa, or any kind of oral medications or any Kriya Kalpas, if it is not possible to conserve the teeth, then we can go for a dental extraction or tooth extraction. When a pain of the patient doesn't subside, it advised for extraction. Tooth extracted by using a Sandhamsha or Danta Nirghatana Yantra. 2 instruments we use, that is Sandhamsha Yantra and Danta Nirghatana Yantra. Indications, commonly to remove the teeth which have become unrestorable to the tooth decay. Where a conservation of a tooth is not possible, then we can go with this procedure, that is tooth extraction with Jalandhara Bandha. Periodontal disease or any dental trauma, where a tooth can't be survived or conserved, where also we can indicate in among 8 Dantarogas like Dahalana, Bhanjanaka, Krimidanta, where tooth saving is not possible. Contraindication for this procedure is any neck injuries, pregnancy, uncooperative patients, bleeding disorders, and hypertensive patients. Tooth should not be extracted in a Krushra, Dharubhala, and Ruddha, as these will lead to Vata vitiations. We can't do these peoples, or we can't indicate this for a dental extraction with Jalandhara Bandha. Patients suffering from Vata Vyadis. Maxillary teeth should not be extracted because it has a many forced extraction complications. Benefits of tooth extraction with the Jalandhara Bandha is there is a no require of anesthesia, any injections, spray, antibiotic, and analgesics, as it is a purely combination of yoga and Ayurvedic techniques. There is a no need of anesthetic agents or any injections, etc. An ideal tooth extraction may be defined as painless removal of whole tooth, or a tooth roots with a minimal trauma to the investing tissues so that wound heals and eventually with the no post-op complications. Steps of tooth extraction using the Jalandhara Bandha Yoga. There are 3 steps, that is pre-operative, operative, and post-operative. Next slide. Purva Karma, basic investigations, and patient should be in an empty stomach, prior intimation and consent. Next slide. Patient consent is very important because this procedure needs a sattva of the patient. Patient should be educated priorly. That patient should be, he should mentally and physically, he should be strong. Prepare for this, we have to take a consent and educate patient priorly. While performing the extraction, we have to take care that patient should not be crushed. Next. So, Pradhana Karma or operative procedure, a low broad stool enable to dental surgeon to maximize appropriate pressure in a right areas for Jalandhara Bandha Yoga. Ask patient to sit on a broad stool. It will maximize the pressure on a right areas. Next slide. With the continuation of operative measures, patient should be calm, relaxed, and should be concentrated on Vishuddha Chakra. Then he is asked to hold his both the knee firmly with his palm and finger. Next, please. Okay. After once a patients get position, then dental surgeon stands behind the patients and put a cloth over his head and bends his head towards the chest, so that chins gets locked to the suprasternal notch or jugular notch. Dental surgeons exerts a mild pressure on the center of the skull with the index finger and the middle finger of a right hand. The palm of a left hand is placed below the mandible with firm pressure for support. As this picture gives a clear idea about a patient position and a physician's position, where he used to put a pressure and position of handling the pace. Next slide, please. Dental surgeon ready with the forceps, lift the patient head upwards and backwards towards the dental surgeon's pubic region for a support during the extraction. The patient is then instructed to open their mouth. The forceps are applied to the tooth to be extracted. Next slide, please. This is a small clip of a video. If it is possible, you can play it. Yeah, thank you. Next slide, please. Sir, next slide, please. Excuse me. This video shows how the extraction is carried out. I'll go to the next slide. As it is said, Vatadrite na astiruja, a reference from Sushruta Samhita. There is a no pain without Visheshna Vatadosha. Next slide, please, sir. Yeah. It is said that Vatadrite na astiruja. There is a no pain without Visheshna Vatadosha. Here a Vata is controlled by doing Jalandhara Bandha, which in turn blocks the pain pathway and thus helps in painless tooth extraction. A precaution should be taken care, that is, don't stress over a neck, jaw or a throat. It may cause injuries or a trauma. Avoid collapsing upper vertebra. Next, post-op cares or a Pashchat karma. Patient should be given Vranaropan and Raktastambhaka Gandusha Dravyas. Patient is advised not to spit forcibly and ask patient not to use a hot and spicy foods for 24 hours. Next slide. This is a reference from Ashtangridaya Uttara Tantra for the Pashchat karma. What drugs should be used? That is St. Madhu, Shrunghataka, Taila. Preparation from these drugs can be given as the Gandusha Dravya. Next slide, please. Acharya Vagbhata told about post-extraction measures, that is Pashchat karma. Gandusha with Taila and St. Madhu churna or a just Gandusha with Madhu can be advised. Nasa with Taila prepared from Dashaguna Kshira, Vidhari, St. Shrunghataka. Ask patient to bite a cotton gauze for at least 30 minutes. Avoid a hot and cold intakes, cold compression with the ice packs. Next slide, please. Yeah. A probable mode of actions of tooth extraction with Jalandhara Bandha is with this technique, all kinds of tooth like maxillary, mandibular, anterior, premolar, molar, wisdom, and even deciduous or a milk tooth can be extracted successfully without any complications. Jalandhara Bandha brings mental relaxations, relieves the stress, anxiety, and this peaceful state of a mind, it will be easy to extraction. Next slide. Though Jalandhara Bandha was not effective in inducing anesthetic effect, still by the virtue of elevation of the pain threshold, advantage of anesthesia is achieved to be satisfactory stage and tooth extraction will be done successfully without any anesthesia. With the Jalandhara Bandha, we can achieve very easily mental relaxations that helps to extraction of the tooth. Next slide, please. In Jalandhara Bandha or while performing Jalandhara Bandha, Ayurvedic surgeons exerts a pressure on trigeminal nerve. This blocks the pain impulses being passed to a brain during extraction and thus successful extraction of tooth without a pain. Next slide. The flow of Sushumna Jala, which supports a group of nadis, that is CSF, stopped for a while along with the Ida and Pingala nadi, thereby achieving a complete mental relaxations, stress-free state, and this helps in increasing of pain thresholds. At this stage, tooth extraction very quickly. By Jalandhara Bandha, posture transient stress-free achieved, and this period is sufficient for painless tooth extraction. Next slide. While doing Jalandhara Bandha, since patient is sitting in erect posture on a ground level stool, circulation into oral cavity will be very less. Hence, the post-extraction bleeding will be very minimal. Next, advantages and disadvantages of this particular tooth extraction with the Jalandhara Bandha. Advantages are no anesthesia is required. Complication of anesthesia can be minimized. Nullifying pain of tooth extraction, no modern equipment is required. That is. Next, disadvantages, this may fail in a neck stiffness or a dislocation of temporomandibular joints may be occur. Next is precautions. Jalandhara Bandha should not be performed in children, persons with cervical spondylitis, breathing difficulties. Patient advised not to drink or eat for an hour. Benefits of tooth extraction by Jalandhara Bandha yoga are no anesthetic complications, can be performed in a patients with high blood pressures and sugars, minimal bleeding, less injuries of healthy tissues, post-extraction complications are very minimal. Conclusion is that a tooth extraction by Jalandhara Bandha yoga is unique and wonderful, cost-effective treatment of Ayurveda, doesn't require any local anesthesia. Hypertension and blood sugar patients also undergo this extraction. References: Sushruta Samhita, Nibandha Sangraha, 9th chapter, and Hatha Yoga Pradipika, then Vagbhata chapter. Thank you.
Thank you, Dr. Shruti. Next, I invite
Thank you,
Dr. Priyanka. I invite Dr. Priyanka.
Dr. Priyanka, please unmute, doctor. Dr. Priyanka, yes, please unmute, doctor. Hello, doctor.
Sir, can you share the PPT, please? I am not able to share it.
Okay, doctor, just a moment. I will share
Yeah.
for you.
And
Please start the session, doctor.
Namaste to all the doctors and delegates. Myself, Dr. Priyanka S. Gange, third year PG students in the Department of Chikitsa, RAMC, Bangalore. So first of all, I would like to congratulate with all the success ongoing Chatushtaya National Seminar Conference. So I have taken up the case for the paper presentation, Kitiba Kushta, treatment of Kitiba Kushta. So preliminary data before and after the treatment is being noted down. Next slide, please. So the name and details of the patient is hidden because of the ethical purposes. So patient came with skin rashes on lower legs associated with itching since 3 months. History and presenting illness will be the patient is known case of diabetes mellitus since 3 months and the skin rashes on back associated with severe itching. He took allopathic treatment for the same and got symptomatic relief, but the rashes were reoccurring on and off. Next slide. Past history of the patient is patient had history of psoriasis 5 years back, took Ayurveda treatment and he got relieved from it. And the patient is on regular medications for insulin 10 units at night and tablet Glimistar M2. So personal history would be he's vegetarian and bowel is occasionally constipated. Appetite is he's having good appetite, micturition 4 to 5 times a day, normal sleep habit, nothing specific. Next slide. General examination included he had a moderate build, well nourished, pallor, icterus, cyanosis, clubbing absent, edema is absent. Systemic examination, CVS, S1 and S2 sounds are heard, no added sounds heard. CNS conscious and well oriented. Next slide. Systemic examination will be multiple lesions will be there, whitish color lesion, localized distribution, discrete arrangements, rough surface palpitations, plaque. Type of lesion is plaque, poorly defined and shape is irregular. Discharge is absent. So Dashavida Pariksha would be Prakriti is Vata Pitta, Vikriti Dosha Vata Kapha, Dusha Rasa Rakta, Sara Madhyama, Samana Madhyama, Sattva Satmya Pramana, Ahara Shakti and Vyama Shakti is Madhyama. Next slide. Ashtasthana Pariksha Nadi is Vata Pittaja, Mala occasionally Baddha, Mutra Shrushta, Jivha Aliptata, Shabda Prakrita Sparsha Khara, Druk Prakrita Akriti is Madhyama. Next slide. Samprapti Gataka, Dosha Vata Kapha, Dushya Rasa Rakta, Agni Jataragni, Dhatvagni, Amad Dhatvagni Mandya Janya, Srotas Rasavaha Srotas, Shroto Dushti Prakara is Sangha, Udbhava Sthana is Pakvashaya, Sanchara Sthana is Sarva Sancharagata, Vyakta Sthana is Twak, Adhisthana is Twak and Roga Marga is Bahya. Next slide. So differential diagnosis is it's between Vicharchika and Kitiba Kushta. In Vicharchika, there is Kandu and Bahusrava will be there, but the present case does not have Bahusrava, which is Kitiba Kushta is finalized. The diagnosis is Kitiba Kushta or Vata Pradhana Kushta. Next slide. Chikitsa Sutra for the Kushta Roga will be Vatottareshu Sarpivamanam, Shleshmottareshu Kushteshu, Pittottareshu Moksho, Raktasya Virechanam Chagre. And taken from Charaka Sutrasthana, 7th chapter, 39th shloka. Apart from that, there is Vamana Virechana Yoktaha, Kalpoktaha, Kushtina Prayoktavyaha, Prachana Alpe Kushte Mahati, Cha Shashtam Siravedanam. So in Vataja predominant Kushta, there will be Sarpipana, that is Snehapana will be given, and Pitta predominant Virechana will be done, and Kafaja predominant Kushta, there Vamana will be done. And in Alpa Dosha condition, Prachana Karma will be done, and Bahudosha condition, Siravedanam, that is venesection is done. And frequently Vamana and Virechana or Shodhana Karma should be done frequently, taking care of patient health also. And we have to see that Vata does not get aggravated. And for that, after the Shodhana Karma, there will be Sarpi or Snehapana will be given to just cancel the Vata. And there will be local treatment given. Lepa, Upanaha, Udvatana and Abhyanga will be given as a local treatment. So in this case, I have given medications, Gugulu Tiktaka Grita, Maha Manjishtadi Kashaya, tablet Dharma 18, Kaishora Gugulu, Anuloma DS and GP ointment. Next slide. So Sadhyo Virechana is given with Nimbamritadi Eranda Taila, and with after the Abhyanga with Eladi Kera Taila and Asanadi Kashaya Parisheka. So after 1 week, the GTG, that is Gugulu Tiktaka Grita and GP ointment is stopped, and again after 1 week 35% of the symptoms is reduced. And second session or second sitting of Sadhyo Virechana with Nimbamritadi Eranda Taila, same with Abhyanga with Eladi Kera Taila and Asanadi Kashaya Parisheka is done, and after 1 week 90% of the symptoms got reduced. Next slide. So these are the before and after results. So there will be reduction, 90% reduction in the lesions. Thank you. Any doubts? Thank you for giving me opportunity for presenting my paper presentation. Thank you so much.
Thank you, Doctor.
Thank you, Doctor.
So next I invite Dr. Swati Raikwar. I invite Dr. Swati.
Yes, ma'am.
Dr. Swati, please share the screen, Doctor.
Yeah. Can you please share the slide?
Okay, Doctor, just a moment.
Okay, thank you.
Dr. Swati,
Yeah.
start the session, Doctor.
Good evening, everyone. Myself, Dr. Swati Raikwar, second year PG scholar, Department of Shala Ketantra, GMC, Bengaluru. My seminar topic is role of Dincharya in prevention of eye diseases. Next slide. Introductions. Eyes are most significant among the sense organs, which reflects the beauty and health of an individual. Disturbance of vision directly or indirectly affects the normal functioning of other senses too. Prevention of eye disease and maintaining the ocular health in this era is of prime importance. In present time, digital screen time has increased drastically due to the online classes, work from home, and thus induces stress and strain to the eyes. This augments
the occurrence of various visual disturbance and other ocular diseases such as myopia, dry eye syndrome. Ayurveda, the science of life, always offer prime importance to the prevention of disease before their manifestation. Ancient Acharyas describe Dincharya, Ritucharya, Patya Ahara Vihara, Rasayana for the maintenance of ocular health. Various yogasana and techniques like Trataka can also be practiced in this time, which will help in preserving normal functioning of the eyes. Next slide, please. Dinacharya, daily regimens. Acharya Bhagavad says that routine which is followed daily or every day is termed as Dinacharya. Daily routine denotes the way people live, reflecting the whole range of activities, attitudes of every day from sunrise to sunset daily. These activities are useful to restore eye health and proper vision. Various Dinacharya's modalities are as follows: Netra Prakshalana, Anjana, Navana, Abhyang, Pad Abhyang, Snanam, Gandus and Kaval, and Dhumpa. First is Netra Prakshalan. It is advised to wash eyes with warm water, Lodra Kashayam, Trifala Kashayam, Amlaki Swaras after getting up from bed in the morning. Phytochemical studies prove that presence of many phenolic, glycosides, flavonoids in these drugs having antioxidative and anti-inflammatory actions, which is favorable for the eyes. Next is Anjana. Anjan is the procedure of application of collyrium to the eyes, which improves the vision. Medicine is applied from Kaninak Sandhi to Apang Sandhi with the Anjan Shalaka. Shavir Anjan should be applied daily for clear vision. Rasanjan should apply once in 7 days according to Bhagavad-acharya, or once in every 5th or 8th night according to Charakacharya. This will stimulate the secretion and clears the vision. It is said that the netra is tejoamyam, but it is easily susceptible to kapha dosha kopa, the anjana having lekhana guna, which will help to remove the vitiated kaphadi dosha and mala, thus enhances the vision. Next is Nasya. Navan or Nasya is the nasal medication in the form of aqueous or liquid extraction of herbs which nourishes the organ above the clavicle. Nasal cavity having direct connection with the sensory neural structures of brain. In classic, it's said that Nasa hi Shirasodaram, means nose is the gateway of head. Thus, the medicine applied through the nostril reaches the Shrangatakamarma, which is the junction of channels from organ of vision, hearing, smell, and taste. One can practice Pratimarsanasya, 1 to 2 drops in each nostril with medicated oil like Anutela, Panchendriya Vardhan Tel, Shadabindu Tel to prevent disease of sense organs and enhances their strength. Next is Abhyanga, procedure of applying medicated oil to the body, especially to the head, ears, feet, is an important part of Dinacharya, which is very effective in enhancing the visual senses. The oil applied on the Murdha act on the brain and the optic nerve, which is direct extension of the brain stem. This normalizes the Pranavaha, which controls the functioning of eyes. Abhyanga nourishes the nerves and helps in prevention of various degenerative disorder of the eyes. The oil for Abhyanga should be selected according to the prakriti of individual. Next is Pada Abhyanga. Massage of feet helps in impart sleep and give clear vision. The foot massage will improve blood circulation, prevents the accumulation of deoxygenated toxins in the distal body part. Prolonged accumulation of deoxygenated toxins will affect the eyes, as both are having association with vernix area. The somatic sensory area in the cortex will get stimulation as nerve supply from both feet and eyes ending in the same area of cortex second of brain. Next is Snanam. Cleansing the body with medicated water is beneficial for the health and normal functioning of the senses. Application of Krishna Tel on head during bathing helps in alleviating Vata dosh and good for eyes. Similarly, Madhuk and Amlaka will alleviate the Pittaj rogas of eyes and enhances vision in patients with Timir. Application of paste of Bachadigan prevent Kafajaneta rogas. Ushna Jal Snanam is beneficial for the lower body but not to the head, as it will affect the health of eyes and hair. Cold water bath is always good for eyes. Next, Gandus and Kaval, a special method of medication in which the liquid or semi-solid medicine is retained in the oral cavity for a prescribed time. In Gandusha, the oral cavity is fully filled with the medicine, but in Kavala, the amount will be less so as to move it. Medicine will be absorbed through the oral mucosa by the pressure effect. The ophthalmic branch of ophthalmic artery lies along the cheek. Thus, the medicine absorbed may reaches the eyes, nourishes, stimulates, and make them healthy. Next is Dhumpan, a special technique of inhalation of medicated smoke through nose and mouth, effective in Akshishul and in various Netra rogas. Vata Kapha disorder of Urdhajatru can be prevented or pacified by using Dhumpan. Due to Sukshma Gun of drug used for Dhumpan, it enters the minute channel and due to Tikshna and Ushna Gun liquefies Kapha and helps in the excretion of Kapha. It stimulates the nerve surrounding the area of nasopharynx, endocrine system and nervous system. Next is discussion. In present time, each individual should make effort to protect and promote own health. Eyes are the most delicate organs of the body and should be free from stress. But the present situation makes the eyes overburdened due to the lifestyle changes, increased screen time and lack of nutritious diets. As a result, the population will suffer from various eye diseases such as dry eyes, computer vision syndrome, refractive errors, glaucoma, diabetic retinopathy, hypertensive retinopathy, age-related macular degeneration, even from the early stages of life. It is the need of the hour to develop an integrated approach to preserve and promote the ocular health. Prevention of disease is possible by lifestyle regulation and adopting Ayurveda principle in life. Ayurveda gives a path towards the health through the Dincharya, Ritucharya and Sadhvat practices. Next conclusion, as the most significant sense organ, there is no doubt that one should maintain the health of eye till the end of life. In this challenging situation of the world, everyone can make use of the time and bring about few modifications in our daily routine by adopting the Ayurvedic principles can make wonders in the preserving our eye health and prevent or delay the incidence of ocular diseases. Simple techniques like Anjana, Nashya, Abhyanga can be included in the daily regimen, which will improve the vision and prevent many diseases of eyes. Thank you.
Thank you, Dr. Swadhi. Next, I invite Dr. Sai Om Prakash Vakmare for the paper presentation. Hello, Dr. Sai. Please unmute, Doctor. Hello, Dr. Sai Vakmare. Are you there? Hello, Dr. Sai, please unmute, Doctor. Hello, Dr. Sai, can you hear me? Okay, next I invite Dr. Jyoti Shidole for the poster presentation. Dr. Jyoti, are you there? Hello, Dr. Jyoti, are you there? Okay, next I invite Dr. Faisal Arif Khan for the poster presentation. Dr. Faisal, are you there? Faisal, are you there? Okay. Today's presentation are come up to the end. Dr. Sai Om Prakash, are you there? Hello, Dr. Sai Om Prakash, are you there? Okay, next I would like to invite Dr. Aishwarya RS to conclude the session.
Thank you, Dr. Sabir. So, dear participant, today's presentation is over now. And one more day left for the final presentation. And before going to wind up, I would like to thank